as of I believe all of you have covered this the regular course on forensic medicine. Now we are going to do a rapid revision, which will help you a lot in revising all that has been taught in a detailed manner. Revision is the key. So let's start from the legal revision of legal procedures. As you know, Indian laws, three types: IPC, CRPC, and Indian Evidence Act. So it is mainly the CRPC and Indian Evidence Act are few, IPC are more. So let us revise those first. 44, 45, 46. What was the mnemonic? I, L, D. 44, 45, 46, ILD. I for injury, I for injury, L for life, D for death. Okay. Now, sections for criminal responsibility. There are 5 sections for criminal responsibility. As per 82 IPC, a person below how many years of age is not responsible? Below 7 years, absolutely no punishment. 83 IPC, between 7 to 12 years, it will depend upon case to case. That is, so as per 82 IPC, below 7 years, absolutely no punishment. 83 IPC, 7 to 12 years, punishment may or may not be given case to case. 84 IPC is criminal responsibility of mentally ill. This is derived from which rules? McNaughton's rules. Then 85 IPC, criminal responsibility of a involuntary intoxicated person. And 86 IPC, voluntary intoxicated person. So in this, you can easy way to remember, in 84 and 85 the person is not responsible. In 86 the person is responsible. 87 to 92 IPC is for consent. All these, the important ones are 88 and 92. 88 is for that in all routinely consent has to be taken. 92 IPC, in emergency life threatening conditions, consent is not required. This is 92 IPC. 191 to 201 IPC, these are for false evidence. And it is 4 are more important: 191, 193, then 197 and 201. 191 defines perjury. 193 punishment of perjury, that is up to 7 years, up to 7 years. 197 false certificates, punishment for false certificates. Here also the punishment is up to 7 years only. And 201 is causing disappearance of evidence of offense. Causing disappearance of evidence of offense is 201. Okay. 228 AIPT, do not disclose identity of rape victim. This is punishable up to 2 years. This is punishable up to 2 years. 269 and 270 IPC, punishment for spreading dangerous infectious diseases. 294 IPC, obscene, punishment for doing obscene acts. Okay, example, exhibitionism. Okay, this is 294 IPC. 299 to 309 IPC are for murder, suicide, okay, culpable homicide, these kind of things. 299 to 309 IPC. This we will discuss, we will revise again when we come to the injuries chapter. 312 to 316 IPC are for criminal abortion. Okay, 312 with the, when the criminal abortion is done with the consent of mother. 313 when the criminal abortion is done without consent of mother. 314 IPC when the mother dies in criminal abortion. Mother dies because of criminal abortion. 315 IPC, the act itself is punishable. Okay, whether the woman and mother they die or survive, the act itself is punishable. That is 315 IPC. 316 IPC, it's a more grievous act. Here two conditions have to be fulfilled. Number one, the child should be quick, 4 to 5 months of gestational age. Number two, the criminal abortion is done by a very heinous act. Criminal abortion is done by a very heinous act. Example, hitting on a woman's abdomen. Okay, so this is 316 IPC. 317 IPC. 317 IPC is abandoning a child below the age of 12 years by parents. Abandoning a child below the age of 12 years by parents is 317 IPC. 318 IPC, concealing the birth of newborn by secret disposal of dead body. Concealing the birth of newborn by secret disposal of dead body. 319 to 338, these are very important sections related to hurt, grievous hurt, etc. We will revise when we come to the injury chapter. 351 IPC is for assault. Assault means to threat, basically to threaten someone, that is assault. 359 to 369 IPC is for kidnapping. Okay. Sexual assault laws, this we will revise when we go to the sexual offences chapter. Now, these are the two sections related to dowry. 304B, here the death within 7 years of marriage. That is dowry death. Okay. Punishment is minimum 7 years and maximum up to life. Punishment is minimum 7 years and maximum up to life. This is 304B. 498 AIPC is for when the woman is subjected to cruelty by husband or in-laws. Woman is subjected to cruelty by husband or in-laws. Okay. Here the woman may be alive, but she is subjected to cruelty. Now, importance. So these were the important IPCs. Now let's come to the important CRPCs. There are very few. The CRPC number 2, it gives various definitions like cognizable offense, non-cognizable offense, warrant cases, summon cases. These are defined under section 2 CRPC. 39 CRPC says that if any major offense has occurred, then inform the police or magistrate. If any major offense has occurred, then inform the police or magistrate. If you do not follow the section 39 CRPC, then the person can be punished under 202 IPC up to 6 months. 53 and 54 CRPC, both are for arrested person. Both are for arrested person. As per 53 CRPC, the consent is not required for medical examination. As per 53 CRPC, consent is not required for medical examination of an arrested person. 54 CRPC is also for arrested person, but it is the accused himself, arrested person himself can request magistrate for his examination. Arrested person can himself request the magistrate for his examination. Now, 61 to 69 CRPC is for summons. Okay, if someone does not attend the summon, if the summon is served and he does not attend it, then he can be punished under the section 172 IPC. Okay, up to 6 months and fine up to 1,000 rupees. Now, 174 and 176 IPC is for inquest. 174 is for police inquest. 176 IPC is for magistrate inquest. Magistrate inquest is done in which, say, in most conditions, police inquest is only done. In most conditions, police inquest is done. Magistrate inquest is done only in 3 conditions only. What are these? Number 1, exhumation. Number 2, dowry death. Number 3, custodial death. Custodial death. And here further important is for exhumation and dowry death. For exhumation and dowry death, only executive magistrate can do the inquest. But for custodial death, it has to be done by the judicial magistrate only. Okay, this is 174 and 176. 416 IPC is death penalty of a pregnant woman. It relates to the death penalty of a pregnant woman. It can be postponed or changed to life imprisonment. Okay, this is 416 CRPC related to death penalty of pregnant women. Now, Indian Evidence Acts, they are also very few. 32 Indian Evidence Act is for dying declaration. 45 is for expert witness. 114A is for rape. That in a case of rape, accused has to prove normally in all the cases, the onus to prove that she is a victim or he is a victim, the onus lies on the victim. But rape is an exception when the onus lies on the accused. This is 114A. 141, 143 and 143, these are for leading questions. Leading questions. Now, dying declaration versus dying deposition. Which one is followed in India? Dying declaration is followed in India. And oath, accused, lawyer, cross-examination, leading questions in a dying person, these are very important. So these are not a part of dying declaration, but these are a part of dying deposition. Okay, dying declaration anyone can record, and dying deposition only magistrate. Okay. Now, courts. Supreme Court and High Court, any fine, any years of imprisonment, any death penalty also, and any amount of fine. Now, sessions judge and additional sessions judge, both sessions and additional, they can give any amount of imprisonment, death penalty, yes, but the death penalty given by sessions judge or additional sessions judge has to be confirmed by the higher court, high court. Okay, fine, any amount of fine. Okay, then assistant session judge, imprisonment, any, death penalty, no. Sorry, assistant sessions judge will give imprisonment up to 10 years. Okay, 10 years. Death penalty, no. Fine, any. Chief Judicial Magistrate, it will give punishment up to 7 years. Death penalty, no. Fine, any. Okay. First class judicial magistrate or first class metropolitan magistrate, both are the same thing. Imprisonment up to 3 years. Death penalty, no. Fine up to 10,000 rupees. Second class metropolitan magistrate or second class judicial magistrate, imprisonment up to 1 year. Death penalty, no. Fine up to 5,000 rupees. Okay. So this is what you have to remember for the power of various courts. Leading questions. Leading questions, when are they allowed and when are they not allowed? Leading questions are allowed in number 1, dying deposition. Dying deposition, and number 2, they are allowed in cross examination. Leading questions are not allowed in dying declaration, then they are not allowed in examination in chief and re-examination. Okay. Now, schedules of MCI, three schedules: Schedule 1, Schedule 2, Schedule 3. Schedule 3 has two subparts, 3A and 3B. Schedule 1 gives the degrees granted by medical colleges in India. Schedule 2, degrees granted by medical colleges in foreign. Schedule 3A, again, the India medical colleges which are not described in 1 will be defined in 3A. The foreign medical colleges which are not defined in Schedule 2 will be defined in Schedule 3B. Now, euthanasia can be classified in two ways: passive versus active, and the second way of classification is voluntary versus non-voluntary versus involuntary. Passive is when you withdraw the life support. So, passive is withdrawal of life support. Withdrawal of life support. Active euthanasia is, for example, actively giving a lethal injection. Actively giving a lethal injection. Which one is allowed in India? Passive is allowed in India, but only in rare conditions. And also you have to take permission from the High Court. In rare condition it is allowed, but you have to take permission from the High Court. Voluntary, the second way of classification is voluntary, non-voluntary and involuntary. Voluntary means the patient gives consent. In non-voluntary and involuntary, both of them, the patient does not give consent. But what's the difference? In non-voluntary, the patient is incapable. The patient is incapable to give consent. Example, he is in coma. That is non-voluntary. And involuntary, the patient is capable, still the consent is not given. So it is done against consent. Against consent. So this is just equal to murder. This is just like murder. Okay. Now, various declarations very commonly asked. Declaration of Hawaii. Hawa में रहने वाला. This is for mentally ill. Declaration of Helsinki. H for Helsinki. H for human experimentation. Declaration of Malta. Malta is a fruit. So, Declaration of Malta is for hunger strikes. Oslo. Double O in Oslo. So, therapeutic. Oslo is for abortion. Double O in abortion. Declaration of Ottawa. Otta, chota. So, Declaration of Ottawa is for child rights. Declaration of Sydney. D in Sydney. And Declaration of Tokyo is for death. Declaration of Sydney is for death. Declaration of Tokyo. T for Tokyo, T for torture. Okay. Now, these three, Declaration of Geneva, Hippocratic Oath, as well as International Code of Medical Ethics, all three of them are basically related to medical ethics. All three of them are basically related to medical ethics. Okay. Now, please remember this mnemonic: CSBB. Cornea 6 hours, skin 24 hours, bone 48 hours, blood vessels 72 hours. CSBB 6, 24, 48, 72. Okay, so this was a rapid revision of legal procedures. I hope this will help you. Revision helps a lot in remembering, and I hope this is the basic purpose of revision is to remember the key points, and the basic purpose of the regular course is to make your concepts clear, and the combination of both can lead to the amazing results. This is what which has been seen in multiple researches. Now, coming to the rapid revision of medical law and ethics. So, main thing, what's the difference between medical ethics and medical etiquettes? Medical etiquettes is how these are moral principles. Remember this word. Medical ethics are the moral principles. This word is important. Medical etiquettes are the conventional laws of courtesy. Conventional laws of courtesy. Moral principle is how a doctor should behave with another doctor, patient, and society in general. Medical etiquette says how a doctor is supposed to behave with another doctor. Medical ethics is mandatory. Medical etiquettes are not mandatory. So, if a doctor does not follow medical ethics, then he can be punished for infamous conduct. If a doctor does not follow medical ethics, he can be punished for infamous conduct. So, now coming to the second point, what is infamous conduct versus medical negligence? Infamous conduct is any disgraceful act is important, but disgraceful act by the doctor in regards to his profession. Medical negligence is lack of reasonable care or skill which leads to death or injury of the patient. So, death or injury occurs in medical negligence. It may not occur in infamous conduct. Who gives punishment for infamous conduct? Punishment by State Medical Council. Punishment will be for infamous conduct will be given by State Medical Council. And who will give the punishment for medical negligence? It will be given by courts. It can be either civil court or criminal court depending upon the circumstances. What is the punishment for infamous conduct? For infamous conduct, the punishment will be either initially a warning notice, simple warning notice, and after that professional death sentence. Professional death sentence, that is removal of the name of the doctor from medical register. Removal of the name of the doctor from medical register. What is the punishment for medical negligence? It can be either fine or imprisonment. It can be either fine or imprisonment. So there are three sections for medical negligence. 304A is when the person dies due to negligence. 337 is when the person suffers a simple hurt due to negligence. 338 is when the person suffers a grievous hurt due to negligence. This 304A is the most important. Here you remember the punishment also. Again, I will say you don't have to remember the punishment for each and every IPC, only the few ones. For 304A, if the person dies due to some negligence of the doctor, doctor can be punished up to 2 years. Clear? Medical records maintenance. Just remember the two things: 3 days, 3 years. Just remember this two figures. If the when I say medical records, I basically mean inpatient records, hospital records when the patient was admitted. I'm talking about inpatient records. So anybody asks for if the patient or his relative asks for the inpatient records, provide within 3 days. Provide within 3 days, and they should be maintained for at least, hospital should maintain them for at least 3 years. Medical legal doctrines, professional secrecy, very important. Keep all the secrets, do not disclose of the patient. But there are certain exceptional conditions where the secrets can be disclosed. What is the technical term for those conditions? These exceptional conditions are called privileged communications. Privileged communications. Example, in the court, you have to disclose everything. Therapeutic privilege, again, certain exceptional conditions where doctor may not disclose information to the patient, but he may give it to the relative. For example, in cancer, doctor thinks patient can suffer a breakdown, he may tell this to the relative instead. Corporate negligence, when the hospital is at fault. Products liability, when the manufacturer is at fault. Vicarious liability, respondent, superior or captain of the ship doctrine simply means that the senior person is responsible for the act of his junior. Novus actus intervening, this implies new action intervening. Res ipsa loquitur, that means very obvious negligence. That is, facts speak for themselves. Facts speak for themselves. Example, scissor left in abdominal cavity after operation. Scissor left in abdominal cavity after operation. Now, let's coming to the defenses that a doctor can take against the medical negligence. Number one is no duty on to the patient. It's a cardiology case, patient goes to a nephrologist, no duty on. This is applicable, but except in emergency conditions. In emergency conditions, no matter whatever is the specialty of the doctor, he is supposed to treat the patient. The second thing is the duty was discharged as per the standard defined in various standard textbooks and all, or standard guidelines. Therapeutic misadventure, also called medical maloccurrence, and no one is at fault. Neither the hospital nor the doctor, no one is at fault, it's just a misadventure. Limitation period of 2 years. A patient can be punished only within 2 years of occurrence of negligence. Error of judgment. Again, error of judgment is wrong diagnosis or management despite taking appropriate measures. For example, a disease presenting in a very atypical fashion, which is very difficult to diagnose. Res judicata, or doctrine of double jeopardy. If a case is once a case is decided in the court, it cannot be taken up again as a fresh case. It cannot be taken up again as a fresh case. Only you can appeal to the higher court. Only you can appeal to the higher court. Voluntae non fit injuria, that means to a person who has given proper consent after knowing all the harms, then he cannot claim damages. If a person is giving consent after knowing all the harms, then he cannot claim damages for the harm which occurs. Contributory negligence means when both patient as well as doctor are at fault. There are two doctrines which are related to contributory negligence. These are last clear chance doctrine and avoidable consequences rule. Okay, these are the two related to contributory negligence. So this was all the rapid fire revision of medical law and ethics. Now let's start with rapid revision of identification. Very important, indices for race. Which are the indices used to determine race? CBCH. Cephalic index, brachial index, crural index, humerofemoral index. Cephalic index is something related to skull. Brachial index is radius upon humor, upper limb. Crural index is lower limb. Tibia upon femur. Tibia upon femur. Humerofemur, both upper limb and lower limb. Humerus upon femur. So CBCH is for race determination. And then the cephalic index is most important. Three types: dolichocephalic, number 2 mesocephalic, number 3 brachycephalic. Dolichocephalic is what the cephalic index? They are long-headed. Cephalic index is shortest, 70 to 75. The cephalic index is 70 to 75. Mesocephalic are medium-headed. Their cephalic index is 75 to 80. Brachycephalic are short-headed. Their cephalic index is longest, 80 to 85. Dolichocephalic is found in, you can remember like this, A and A. Dolicho is found in A and A. A for Aryans, N for Negroes, A for Aborigines. Mesocephalic is found in Caucasians, that is whites, or it is also found in Indians. It is also found in Chinese. And brachycephalic is found in Mongoloids. When I say Mongoloids, I basically mean people living in Mongolia, not in China. Chinese have mesocephalic. age, timelines of age by dentition. So suppose this is the birth has taken place, 0 month. First temporary teeth start erupting at what age? The first temporary teeth start erupting at 6 months. And which, okay, so temporary teeth start erupting at 6 months of age. And all temporary teeth are erupted by 30 months of age, 2.5 years. By 2.5 years, all temporary teeth have been erupted. Okay, all temporary teeth are erupted by 2.5 years of age. Then, at 6 years of age, what happens is temporary teeth, they start falling and permanent teeth start erupting. Then till 11 years of by 11 years of age, all temporary teeth fall. So period of 6 to 11 years is the period of mixed dentition, when both temporary and permanent teeth are present. The period of 6 to 11 years is the period of mixed dentition, when both permanent and temporary teeth are present. And after 11 years, rest of the permanent teeth will erupt. So, and also remember the formula for temporary teeth. Remember the mnemonic IMCM. Okay, incisor, first molar, then canine, and then the second molar. 6, 12, 18, 24. IM6CM, 6, 12, 18, 24. Incisor at 6, first incisor at 6 months, first molar at 12 months, canine at 18 months, second molar at 24 to, actually 20, second molar is 24 to 30 months, but for remembering you can remember like 24 months. Now, what is the mnemonic for permanent teeth? For permanent teeth, okay, I will write it here. For permanent teeth, the mnemonic is mother is in pain, Papa can make medicine. First, coming to certain ossification centers which develop in the intrauterine age, which is the first center to appear. First center is that of clavicle. It appears at 1.5 months of intrauterine age. It appears. Then after that, the primary centers of the long bones, that is the diaphysis, of most of the long bones, they appear near about 3 months of age. Okay, then calcaneum, manubrum sterni, and S1 sternibrae. So the body of sternum has actually the 4 different ossification centers: S1, S2, S3, S4. So calcaneum, manubrum sterni, and S1 sternibrae, these 3 appear at 5 months of age. Okay, S2, S3, and talus, these 3, they appear at 7 months of age. These 3 appear at 7 months of age. Cuboid and lower end of femur, they appear at 9 months of age. Cuboid and lower end of femur, they appear at 9 months of age. Upper end of tibia and S4 sternibrae, these appear at 10 months of age. Intrauterine life. So when we say intrauterine life, you can remember like this, that cuboid and lower end of femur just before birth. One way of remembering is just before birth, and upper end of tibia and S4 sternibrae just after birth. Okay, Xiphisternum does not occur in intrauterine age. It occurs later on, but just to, because we are discussing other sternal ossification centers, that is the reason we are discussing here. It appears at 3 years of age. Okay. So this is about the intrauterine age. Now let us discuss some of these other bones. Skull suture. Fusion becomes earlier where inner or outer side it occurs 5 to 10 years earlier on inner side as compared to outer side. Now we will discuss the fusion on outer side. Inner side would have occurred 5 to 10 years earlier. So in inner side it is 5 to 10 years earlier. So we will just discuss the fusion on outer side. Inner side will be 5 to 10 years earlier. In general, remember, fusion occurs earlierly on the posterior end and on the lower end. So sagittal suture, coronal, lambdoid, parieto-temporal. For sagittal suture, posterior 1/3 first, then anterior 1/3, and then the middle 1/3. So PAM, remember the word PAM, posterior 1/3 and posterior 1/3, 30 to 40 years, it fuses. Anterior 1/3 fuses at 40 to 50 years. Middle 1/3 fuses at 50 to 60 years. Coronal, lower first, then upper. Lower half, 40 to 50 years, it fuses. Upper half, 50 to 60 years, it fuses. Lambdoid suture fuses at 50 years of age. Parieto-temporal fuses at 60 to 80 years of age. So this will help you in remembering that posteriorly and lower side is appearing earlier comparatively. And for example, and now in basi-occiput fuses with basi-sphenoid between 18 to 21 years of age. Posterior fontanelle, anterior fontanelle. Same thing, posterior fuses first, anterior later on. Posterior fontanelle, you can remember posterior fontanelle fuses at 1.5 months, anterior fontanelle fuses at 1.5 years approximately. Now, clavicle. Clavicle has two ossification centers. One is for the middle end. One is for the body. One is for the body. Other is for the inner end of clavicle. Ossification center for the body, I told you it's the first center to appear. It appears in 1.5 months of intrauterine life. It appears. Ossification center for the inner end, it appears at 18 years of age, and these two, they fuse with each other at 21 years of age. These two fuse at 21 years of age. Now, coming to hyoid bone. Hyoid bone fuses at 40 to 60 years of age. Okay. Now, sternum. Sternum is interesting. Okay, so age of appearance of centers we have already discussed. They all appear in the intrauterine life, that we have all discussed. Now we are discussing the age of fusion. So manubrium, body, xiphisternum. Xiphisternum fuses with body at 40 years of age, and body fuses with manubrium in late age, that is 60 years of age. Okay, easy to remember. Xiphisternum with body 40 years of age, body with manubrium 60 years of age. Now the body has 4 different ossification centers. Okay, now these ossification centers, they fuse with each other between 14 to 25 years of age. These ossification centers fuse with each other between 14 to 25 years of age. Now, coming to carpal bones is also very easy. For carpal bones, what you have to remember is first carpal bone 2 months of appears at 2 months of age. When I say 2 months, means 2 months after birth. Second carpal bone appears at 4 months of age. So these two appear early. Before 6 months of age, both of them are appearing. After that, the third carpal bone appears late. So third carpal bone, fourth carpal bone, fifth carpal bone, sixth carpal bone, and seventh carpal bone. Third carpal bone appears at third year of life. Fourth carpal bone appears at fourth year. Fifth carpal bone appears at fifth year. Sixth carpal bone, you can remember, it appears at 6 years. And seventh carpal bone, it appears at 7 years of age. Actually, it's not that exactly they are appearing, fifth carpal bone is appearing exactly at 5, sixth at exactly 6 years. It's not like that. Different books will have different values. They are nearby this age, but this will help you in remembering. You should have the approximate idea. Then after that, the eighth carpal bone appears again late. This is pisiform. It appears between 9 to 12 years of age. Okay. Now, for the long bones, now this is also very interesting. I will just give the high level facts which will help you again a lot in remembering. When I say long bones, basically we talk about the 6 joints. Number one is the the 6 joints, the shoulder, elbow, wrist, upper end of femur, knee and ankle. So what we are going to do is we are going to divide this elbow joint and ankle joint, we are going to write separately, and we are going to write shoulder joint, wrist joint, upper end of femur and knee joint separately. Elbow and ankle joint, they fuse at 14 to 16 years of age, or in fact, 14 to 16 years of age, or rather I will say 16 to 17 years of age, 16 to 17 years of age, and the other 4 fuse slightly late between 17 to 19 years of age. Okay, so if I have to make a diagram, this is humerus, head, the upper end, this is the upper end of humerus. Upper end has 3 centers: head, greater tubercle and lesser tubercle. Remember the mnemonic: 1 year, head appears at 1 year, greater tubercle 1 3 5. Head appears at 1 year, greater tubercle at 3 years of age, and lesser tubercle at 5 years of age. 1 3 5. These 3 fuse with each other at 6 years of age to form one upper end, and it fuses with the shaft at 17 to 19 years of age. Now the lower end of humerus has 4 centers. Okay, so suppose this is the medial epicondyle, this is trochlea, capitulum and lateral epicondyle. Then what happens is the lateral epicondyle, capitulum and trochlea, these 3 fuse together to form one conjoint epiphysis at 12 years of age, which fuses with the shaft at 14 to 16 years of age. So these three are becoming one bone at 12 years, which is fusing with the shaft at 14 to 16 years. The medial epicondyle is fusing separately with the shaft at 16 to 17. So medial epicondyle fuses with the shaft separately, little bit age 16 to 17 years. So suppose here we draw ulna and here we draw radius. Ulna, here you remember that the lower end of radius appears at 2 years and upper end of ulna appears at 9 years. So here I am talking about the age of appearance. 2 year, 9 year. Other two in between. Radius appears at around 5 years of age. Lower end of ulna at 6 years of age. So you remember like this. Lower end of the radius at 2 years. Upper end of ulna at 9 years. Rest two in between. This is the age of appearance. If I ask about the age of ossification, same. Elbow joint is 16 to 17. So upper end of ulna and upper end of radius with the shaft at 16 to 17 years of age. Lower end of radius and lower wrist joint at what age? 17 to 19. So lower end of radius and lower end of ulna with the shaft at 17 to 19 years of age. This is about the upper limb. If I draw the diagram for the lower limb, now this is, don't go with my drawing, this is femur only. Here the upper end, remember the mnemonic 1, 4, 14. The head appears at 1 years of age. The greater trochanter appears at 4 years of age. The lesser trochanter appears at 14 years of age. These three, they fuse with their shaft at what age? Upper end of femur at what age? 17 to 19 years of age. Low, now then we draw here tibia and fibula. Tibia, fibula. So all this, lower end of femur with the shaft, upper end of tibia with the shaft, upper end of fibula with the shaft. They fuse with each other at 17 to 19 years of age. Now, lower end of tibia with the shaft and lower end of fibula with the shaft. They fuse with each other at 16 to 17 years of age. Okay. Now coming to the hip bone, iliac crest. Here, what you have to the hip bone. If I talk about the hip bone, so the iliac crest, this iliac crest, it appears at 14 years and fuses with the shaft at 18 years. Fuses with the rest of the bone at 18 years. Now, ischial tuberosity. This is the ischial tuberosity. It appears at 16 years and fuses with the bone at 21 years of age. Triradiate cartilage. Now, this is triradiate cartilage. It appears at 13 years of age and fuses at 15 years of age. Ischiopubic rami, this fuses at 6 to 7 years of age. Now coming to the sex determination by nuclear sex, as you remember there were 4 methods: Barr body, Davidson body, quinacrine dihydrochloride and fluorescent fuel reaction. Now, Barr body is inactivated X chromosome. It's a plano-convex mass near nuclear membrane. Okay. It can be found in almost all the cells, but commonly detected in buccal smear, saliva, hair follicles, etc. Davidson body is found in neutrophils. Here the shape, what is the shape? The shape is drumstick form. Quinacrine dihydrochloride is used to stain Y chromosome. And fluorescent fuelogen reaction is used to stain X chromosome. Okay. Now, Krogman's table. Krogman's table, if the entire is the accuracy for the sex, it is for the accuracy of sex determination. If the entire skeleton is available, then the accuracy is 100%. Pelvis and skull, 98%. Pelvis alone, 95%. Skull alone, 90%. Long bones alone, 80%. So which is the best bone for sex determination? If individual one bone is asked, the best bone is pelvis. Okay, this is Krogman's table. Now, sex determination in bulls, only the main features. If I talk about the male skull versus female skull. So I told you most features more prominent and large in males and large in males. Okay, but there are certain exceptions that you have to remember. Then exceptions which are larger in females are, this is what you have to, the 3 features that you remember: frontal eminence, parietal eminence, and orbits. These are the 3 features which are larger in females. Please remember. Okay. Now for the mandible, I would like to say that based upon the angle of mandible is more obtuse. Remember, in CEF, angle of mandible is more obtuse in CEF. Children, elderly, and females. Angle of mandible is less obtuse in in adults and males. So please remember one thing, in CEF the angle of mandible is more obtuse. Now sex determination by sternum, we are talking about the sex differences in the bones. In the sternum, in the males, females, in males, the length of the body is more than twice the length of manubrium. In females, length of the body is less than twice the length of manubrium. Okay, so we have, so now for the indices, I told you for the race determination we have CBC. So please remember for the indices for the race determination we have CBCH, and then most of the other, apart from CBCH, cephalic, brachial, crural, and humerofemoral, these were for the race. Most of the other indices are for the sex determination. Remember like this. For age, we do not have any indices. For stature, we have few formulas that I am going to tell you. So whenever any index is asked, it will usually be either race or sex. Okay, for race you have only 4-5 important indices, CBCH I told you, and rest of the other, most of the indices are for sex determination. And for stature we have few formulas. For age we do not have any index. Which is the index? Sternal index. It is length of manubrium upon body into 100. It is 54. Okay, so it is 46 in males and 54 in females. The second thing in to determine sex from sternum is Ashley's rule. In Ashley's rule, length of the sternum is more than 149 millimeter in females, in males, sorry. It is more than 149 millimeter in males and less than, males I will write here, and less than 149 millimeter in females. Okay. Now pelvis, please remember the various indices which are there in the pelvis. How the question is going to ask, which is the particular index used to, what is the use of a particular index? It is used to calculate age, race, sex or stature. So you should be knowing which are the indices in pelvis used to determine sex. These are, number 1, sacral index. Number 2, corporo basal index. Number 3, ischio pubic index. Number 4, sciatic notch index. Number 5, alar index. So these are used to determine sex. These are the indices, various indices from the pelvis used to determine sex. Okay, and for the formula, please remember that these are the 4 formulas BDKT for the stature: Brettinger, Duparitus and Hedden, Karl Pearson's formula, Trotter and Glasser's formula are for the stature. Okay, now also if our length of the bone is given and you have to identify the length of the person, remember the mnemonic FTHUR. For femur, the largest bone, the multiplication factor is smallest, 3.7 FTHUR. After that, it keep on adding 0.8. So it will become 4.5 for tibia and fibula. Again add 0.8, 5.3 for humerus, 6.1 for ulna, 6.9 for radius. Coming to fingerprinting, what are the different terminologies for fingerprinting? Dactylography, dactyloscopy, Galton system, dermatoglyphics. All these are different terms for fingerprinting. fingerprints can be permanently destroyed in very, very few conditions like radiation injury, electrical injury, and leprosy. No, in most of the other conditions, they are not completely destroyed. What are the different types of fingerprints? Remember the mnemonic: love, wife, and children. Remember the mnemonic: love, wife, and children. L for loops, W for walls, A for arches, C for composite. Loops are the most common and composite are the least common. So this is the incidence: loops followed by walls, followed by arches, followed by composite. So loops are the most common, composite are the least common. Now coming to animal hair versus human hair, what you have to remember is, in human hair, just remember one thing: the medulla is thin. Remember this. In human hair, medulla is thin. That means cortex is broad in human. In animal hair, it will be opposite. Medulla is thick, but cortex is thin. Okay, so just remember one thing. Rest of the things you can always get, you can make out. So human hair, thin medulla. Human hair, thin medulla. Platyscopy or rugoscopy, study of the rugae present on anterior 1/3 of palate. Anterior 1/3 of palate. Poroscopy, study of pores present in fingerprints. Chiloscopy, study of lip prints. Bertillon system or anthropometry is the determination of identification by physical characteristics like height, length, etc. Corpus delicti, also called body of offense or essence of crime. Locard's principal exchange: whenever two bodies come in contact, there is some exchange of physical evidence. That is Locard's principle. So this was our rapid fire revision of identification. I hope this will help you in remembering the various important key points of identification. Now let's jump to the another thing, that is thanatology. Thanatology. Types of autopsy: pathological, only for academic purpose. Consent of relatives is required. Medico-legal, consent of relatives not required. Virtopsy means virtual autopsy by imaging, without cutting the body, just by doing the MRI, CT scan, etc. Psychological autopsy, to understand the mental state of a case of suicide victim. So victim has committed suicide, you go and talk to the relatives to understand his mental state. Obscure autopsy and negative autopsy, understand the difference between these two terms. Obscure means the cause of death is not seen on the gross autopsy, but can be found in by microscopy or by some other investigations, by other lab investigations. In negative autopsy, it can never be found. The cause of death is neither found in gross examination. It's completely negative means completely negative. Remember like this: negative, completely negative is negative. Gross, negative in gross, it's negative in microscopy also. Can never be found. evisceration methods, LGVR. Simple term you have to remember is LGVR. L for Letoile, L for large. Okay, everything together. Cervical plus thoracic plus abdominal plus pelvic, all together. Okay, also called NMAS. Also called NMAS technique. Gons is N block. Cervical separately, thoracic separately, abdomen separately, abdominal organ separately, pelvic organ separately. V for Virchow. This is Gons method is also called N block. Virchow's method is 1 by 1. Virchow's is 1 by 1. Liver separately, spleen separately, each lung separately, okay, each kidney separately. Rokitansky, S from Rokitansky, S from in situ. Body dissected inside the organ dissected inside the body. They are not taken out. That is Rokitansky. Okay. Now antemortem versus postmortem clot. Antemortem clot is made in a proper fashion. So antemortem clot is firm. Postmortem clot is soft. In antemortem clots, obviously there is an injury. That is the reason the clot is getting formed. So in antemortem clot, the endothelium is damaged. In postmortem clot, it is intact. Because the endothelium is damaged in antemortem clot, so the clot will adhere to endothelium in antemortem, but it will not adhere to endothelium in postmortem clot. Now, in the postmortem, the blood is stagnant. So, the postmortem clot will take the shape of the blood vessel, but not into the antemortem clot. Appearance, antemortem clots will be red always. Postmortem clot is of two types. Postmortem clot is of two types. If I write this here, please remember. It can be of two types. One is chicken fat. Second is red currant jelly type. In chicken fat occurs when the clot formation occurs slowly. Red currant occurs when the clot formation occurs rapidly. So R for red, R for rapid. So what happens is chicken clot is like this. It has two layers. The lower layer is red. The upper layer is pale. Upper layer is pale. Red currant jelly type is all red. All red. Okay. So these are the two kinds of post-mortem clot. Now, somatic versus molecular death. Initial death is somatic death, also called clinical death, where there is a stoppage of heart, respiration, and brain functions. And these three together, they are also called Bishop's tripod of life. These three together are also called Bishop's tripod of life. Then most individual cells die after 1 to 2 hours. Most individual cells die after 1 to 2 hours when it is called molecular death or cellular death. Okay, neurons die fastest within few minutes. Muscles die within 1 to 4 hours. Okay. Now, changes after death. Immediate changes, early changes, and late changes. Immediate changes is stoppage of heart, stoppage of respiration, and stoppage of brain functions. This is the death which corresponds to somatic death. Other two, early and late signs, these corresponds to molecular death or cellular death. Okay. The early changes, we will have changes in the eyes, changes in the skin. Sorry, first earliest is changes in the skin. Early changes in the skin. Skin becomes loose, pale, elasticity loses, then changes in the eyes. Then we have post-mortem staining. We have algor mortis, that is cooling of the body. And we have rigor mortis. In late changes, basically decomposition occurs most commonly by putrefaction, sometimes by adipocere, rarely by adipocere, or mummification. Okay. Now, coming to the certain tests, sorry. There are tests for, these tests are obsolete, not done nowadays. Test for death, test to determine, test to diagnose death. We have tests for respiration and tests for circulation. For respiration, remember the mnemonic FMW. For circulation, remember the mnemonic DIMP. Okay, FMW, feather, no movement. Mirror, chest is not moving, no. So, bring the mirror in front of the mouth, no haziness because no breath. Winslow's test, put the mirror on the chest is not moving, so no reflection of the light. So FMW, feather, mirror, Winslow are respiration. Circulation test, DIMP, diaphanous, ICART, Magnus, and pressure test. Diaphanous test, no redness if you put the torch here. ICART test, no discoloration if you put a dye because no circulation. Magnus test, no bluish discoloration if you apply the ligature material because no circulation. Again, for pressure test, if you press the nail and you release it, there will be no change of the, it will not show the reddish color on the removal of the pressure. So DIMP is for circulation, FMW is for respiration. Suspended animation, the person appears dead, but he is actually alive. So it's a state, I will say, between live person and dead person. It's a state. Algor mortis, that is cooling of the body. What is the best place to record body temperature? The best place is subhepatic. The second best place is rectum. What's the rate of cooling? In temperate, tropical. Please remember, in temperate, obviously the cooling will occur faster, 1.5 degree Fahrenheit per hour. And in tropical, it will be half of that. In temperate countries, 1.5 Fahrenheit degree per hour, and in tropical, it will be half of that. Body temperature usually reaches atmospheric temperature in how much time in India? In about 16 to 20 hours. In about 16 to 20 hours. The curve of cooling is sigmoid shape. The curve of cooling is sigmoid shape. Postmortem chloridicity, certain conditions where the body temperature remains increased after death. There are 4 types. When the heat regulation is disturbed before death, that is pontine hemorrhage and heat stroke. Second is heat production due to convulsions. This can occur in tetanus or strychnine poisoning. Third is heat production due to bacterial activity. For example, it can occur in septicemia. Fourth is very high environmental temperature. So these are the conditions where you can see the post-mortem chloristicity, where the body temperature can remain increased after death instead of decreasing. Timelines of post-mortem staining. Post-mortem staining starts, the process starts immediately after death. Immediately after death, but not visible till 1 hour. It becomes visible only after 1 hour. Now, after 6 hours, it is completely formed. After 6 hours of death, the postmortem staining is completely formed, and after 8 hours of death, fixation of postmortem staining occurs. And post-mortem staining persists till 2-3 days. That is till putrefaction. Till putrefaction. Okay. So there's a timeline of post-mortem staining. Rigor mortis. After death, it starts after how much time? It starts after 2 hours. Where does it start? It starts in the first place to say rigor mortis is myocardium, and externally the first place is upper eyelids. Rigor mortis starts in the upper part of the body and slowly it progresses to the lower parts. So for the first 12 hours, it is in developing stage. In the next, so top to bottom it is developing. Then in the next 12 hours, it remains into the developed stage. And then in the next 12 hours, it is in passing stage. Same, top to bottom. This top to bottom appearance and disappearance of rigor mortis, this top to bottom appearance and disappearance of rigor mortis is also called Nisten's rule. It is also called Nisten's rule. Now, what are the conditions which look similar to rigor mortis? Number 1, heat stiffening, also called pugilistic attitude or boxer's attitude. It occurs when the body temperature is more than 65 degrees Celsius, and it can occur in both ante-mortem as well as post-mortem burns. Second thing which looks similar to rigor mortis is cold stiffening. It occurs when the dead bodies are kept in freezing temperatures. Third is gas stiffening, which occurs due to putrefaction. Fourth condition which looks similar to rigor mortis is cadaveric spasm. But the main thing is cadaveric spasm occurs immediately after death, whereas rigor mortis occurs after 2 hours, starts after 2 hours. Cadaveric spasm affects only selected muscles, most commonly hands, whereas rigor mortis, whole body. Okay. Intensity of muscle contraction is much more in cadaveric spasm. Cadaveric spasm gives us the manner of death and cause of death, whereas rigor mortis gives mainly the time since death. Time since death. Okay. Now, late signs, putrefaction is the most common. Okay, it occurs due to which bacteria? Clostridium welchi it has an enzyme lecithinase which destroys the body. Okay, what are the timelines of putrefaction? Putrefaction will occur obviously faster in summer. So we are giving the timelines of summer. Winter will be half. The winter timeline will be half. So you remember, like, double. Winter timeline will be double. So, okay, what we are describing is summer timelines. The color change starts occurring in 12 to 18 hours. Greenish discoloration occurs. Why does it occur? It occurs because of the formation of sulf-met hemoglobin. Okay, so in winter, what will be the timeline? 24 to 36 hours. First external sign of putrefaction is right iliac fossa. The first greenish discoloration occurs externally in right iliac fossa, and first greenish discoloration occurs internally in under surface of liver. Under surface of liver. Okay, in 24 to 48 hours, greenish discoloration spreads to whole body, gas production occurs, post-mortem purge occurs, and marbling occurs. Okay, so these three things occur in 24 to 48 hours: greenish discoloration, whole body, post-mortem purge, and marbling. Then in 48 to 72 hours, prolapse, color becomes black, and gas stiffening. 48 to 72 hours. 3 to 5 days, nails, teeth become loose, skull sutures start to separate. In 7 to 12 days, most organs liquefy. In 1 to 3 months, only skeleton remains. Skeletonization occurs. Skeletonization. That is, only skeleton remains. All soft tissues are destroyed. In few years, even bones are destroyed. Decompose. Even the bones decompose. Okay. Adipocere versus mummification. Adipocere is having foul odor. Mummification is dry, so it has mummification is dry, so it is odorless. Temperature. Please remember, adipocere occurs basically in the warm temperature, not very hot, not very cold. And mummification occurs in hot atmosphere. Adipocere obviously moist. Mummification dry. Appearance, if we talk about the appearance, when fresh, it is, how does the adipocere looks when it is fresh? It is soft, moist, glistening, okay, and grayish white. When old, the adipocere is dry, brittle, and grayish white. And how does the mummification looks? Thin, leathery, dry, thin, leathery, dry, and brownish. Okay. Time required, adipocere 3 weeks to 3 months. Mummification 3 months to 1 year. Okay. So that is about the rapid revision of thanatology. Now let's start with the rapid revision of asphyxia. Coming to asphyxia, the classification of asphyxia is very important. When we say asphyxia, I basically mean mechanical asphyxia. So three types. One is the middle. I will write the compression of neck, then drowning and suffocation. Easy way to remember. Anything other than compression of neck and drowning is suffocation. So compression of neck is of two types: hanging and strangulation. Okay. Now let us discuss the different kind. All others will be the suffocation asphyxias. Now let us discuss different kinds of suffocation asphyxias. So suffocation asphyxias, types of suffocation. Number one, this is number one, smothering. So we are discussing types of suffocation asphyxias. Smothering. Closure of mouth and nose by hands. This is gagging. Putting some object into the oral cavity. Gagging. Third is restriction of chest movement. Now this restriction of chest movement can actually leads to two kinds of asphyxias. One is traumatic asphyxia. Other is postural asphyxia, also called positional asphyxia. In both the conditions, the chest movement is restricted, but the difference is in traumatic asphyxia, there is external force, external trauma, as you can see in this photograph, external trauma that leads to traumatic asphyxia. In postural asphyxia or position asphyxia, it is due to some abnormal position like this, abnormal position. Now in traumatic asphyxia, classical sign which is seen is called mask ecchymotic. That is intense congestion and cyanosis of face and chest. Intense asphyxial signs are seen like this. This is seen in traumatic asphyxia. Mask ecchymotic. Mask ecchymotic is seen in traumatic asphyxia. And postural asphyxia is usually seen into the intoxicated people. Okay, intoxicated people. Now, other types of suffocation asphyxia. So we are discussing types of suffocation. Number one is smothering, gagging, restriction of the chest movement. Two types. Which one are two types? Traumatic and positional. Fourth is burking and overlaying. In both burking and overlaying, there is combination of smothering as well as traumatic asphyxia. The difference is burking is homicidal, so overlaying is accidental. Choking is obstruction of air passages, from inside. Example, inhaling a coin. Cafe coronary is sudden death. It's a type sudden death due to choking. So it's a special type of choking where sudden death occurs and usually the person is intoxicated. Okay, this is cafe coronary. So cause of death, please remember, if the cause of death is asked, then in choking and cafe coronary. In choking, the cause of death will be asphyxia. In cafe coronary, it will be sudden, so it will be reflex vagal inhibition. reflex vagal inhibition, which leads to sudden death. Now, hanging, two types, complete versus partial. It's very simple. Partial is part of the body touching the ground. Part of the body touching the ground. Complete is total suspended. Typical hanging versus atypical. Typical hanging, the ligature knot is over the occipital region. Atypical, all other positions. Now, signs of antemortem hanging. What is the surest sign of antemortem hanging? The surest sign of antemortem hanging is dribbling of saliva. Is the surest sign of antemortem hanging. Another sign of antemortem hanging is la facies sympathetic. Now, types of strangulation: ligature strangulation by a ligature material, manual strangulation by hands, and other name of manual strangulation is throttling. Third is mugging. Mugging is strangulation in the bend of the elbow. Strangulation in the bend of the elbow. Fourth is Bansdola, strangulation by bamboo sticks. Fifth is garroting. Garroting is where we use a lever. A lever is used to twist ligature material. A special type of garroting is Spanish windlass. Spanish windlass is a special kind of garroting, as you can see in this photograph. Now, very commonly asked question, neck injuries. In which conditions neck injuries is seen? First of all, please remember, if any neck injury is shown, neck injuries will not be seen in suffocation. Neck injury will not be seen in drowning. It will be seen only in compression of neck. Okay. And when we see compression of neck, the major types are manual strangulation, ligature strangulation, and hanging. So please remember, neck injuries are most commonly seen in manual strangulation, followed by ligature strangulation, most commonly in manual strangulation, followed by ligature strangulation, and least commonly in hanging. The exception is C2, C3 fracture, which is seen in judicial hanging. The exception is C2, C3 fracture, which is seen in judicial hanging. Otherwise, all other hangings are most commonly seen in manual strangulation, followed by ligature strangulation, followed by hanging. Now, coming to the types of drowning, was the usual normal drowning called typical drowning, or wet drowning, or primary drowning. It can be fresh water or salt water. The other is atypical drowning. It's of 4 types. Dry drowning, it occurs due to laryngospasm. Okay, the water goes to the larynx, laryngospasm occurs, and the person dies. Laryngospasm is the main culprit. Post-immersion syndrome, as a post means dying later. Initially survived but dying later on, also called secondary or near drowning. Hydrocution, it occurs due to, again, reflex vagal inhibition. So, reflex vagal inhibition is the cause of death in hydrocution and café coronary. Shallow water drowning, usually seen in mentally ill, unconscious people. Now, freshwater versus saltwater drowning. What's the feature of freshwater and salt water? I will not go into complete pathology. Salt, easy way to remember, salt means sodium. So, hypernatremia occurs. Hypernatremia. And what occurs in freshwater? Hyperkalemia. hyperkalemia. Okay, remember like this. Salt is sodium. So hypernatremia in salt water, hypernatremia, then hypermagnesemia, hypercalcemia. All these things are seen in salt water drowning. In fresh water, water is going inside the body, water goes into the cell bursts. So hemolysis occurs in fresh water. Hemolysis does not occur in salt water drowning. Now, because more and more water is going inside the body, so hemodilution occurs in fresh water. Hemoconcentration occurs in salt water. Hemoconcentration occurs, so that means HB levels increase in salt water and HB levels decrease in fresh water drowning. Okay. Signs of antemortem drowning. So if you remember, surest sign of hanging was dribbling of saliva, and surest sign of antemortem drowning is grass or weeds tightly held in hands, which is the phenomena of cadaveric spasm. This is the surest sign of antemortem drowning. And the second best sign is the froth of drowning. Froth can be seen in other conditions also, but in drowning the froth is very large in amount, persistent. Even if you try to wipe it off, it will not get wiped off. It's fine, whitish, leathery, tenacious, characteristic features of the drowning froth seen over the mouth, nose, lungs, inside the respiratory tract, everywhere. Emphysema aquosum. So, as the name suggests, emphysema means air, aquosum means water. So both air and water are going inside the lungs. So the lungs become very heavy, overinflated, and this picture is of lungs is called emphysema aquosum. Please remember, emphysema aquosum will occur only if the person is conscious. If the person is unconscious, if you remember, what is going to occur? Edema aquosum. Only water will go inside. Then another is presence of mud in the respiratory passages. So the best sign, cadaveric spasm, grass or weeds tightly held. Second best, froth. After that, emphysema aquosum. Then other signs like mud in the respiratory passages. Then Paltov hemorrhage. Paltov hemorrhage is the sign for drowning. Okay. Paltov hemorrhages are seen only in lungs, only in drowning. Okay. Paltov hemorrhage, only lung, only drowning. Remember like this. Petechiae or tardive spots can be seen at multiple places, multiple conditions. Drown. Okay. So these are petechial hemorrhages, whereas this is Paltov hemorrhage. Paltov hemorrhages are larger. Diatoms are microscopic unicellular algae. Characteristic features, cell wall composed of silica. They are detected by acid digestion technique. Okay, diatoms. This is also a sign of antemortem drowning. Then other signs are presence of water in stomach or intestine, but it's not considered a good sign. Third, a last sign is Gettler's test. This is also not considered a very good sign. That's the reason on the 8th number. Which electrolyte is measured in Gettler's test? Chloride ion. In drowning, what is going to occur is in antemortem drowning, in freshwater drowning, chloride ion concentration will be 50% lower on left side of the heart as compared to right side. Whereas in salt water drowning, the chloride ion concentration will be 30 to 40% higher on left side of heart. Okay, so these were the signs of drowning, but then there are certain signs which are not the sign of drowning, antemortem drowning, but which simply say that body was in water. That means it can be seen in both antemortem as well as postmortem drowning. What are these signs? Cutis serinae and washerwoman's skin. Please remember, these two signs are the signs which simply tell that the body was in water. They will not tell whether it was ante-mortem or post-mortem. Now, manner of death. Hanging, the most common manner of death, obviously suicide. Strangulation, smothering, gagging, burning, it's homicide. And for others, it is accidental. Okay, so this is the manner of death in different asphyxial deaths. So this was about rapid fire on asphyxia. Now let's start with the rapid fire on injuries. Okay, so injuries, if you remember, what were the sections for which tells about murder, suicide, etc., etc.? These are 299 to 309. And please remember like this: 299, definition of culpable homicide. 300, definition of murder. 302, punishment of murder. 304, punishment of culpable homicide not amounting to murder. Please remember, the murder definition 300, punishment 302. Okay, remember this box. Then 305, 306, abetment of suicide. 307, attempt to suicide. Okay. 309 is 305 and 306 is abetment of suicide. 307 is attempt to murder. 309 is attempt to suicide, and this attempt to suicide is now no longer an offense. Okay. Now 319 to 338 IPC, this is for hurt, grievous hurt, etc. So please remember, like 319 defines hurt, 320 defines grievous hurt, which has 8 clauses. 321 defines voluntarily causing hurt. 322 defines voluntarily causing grievous hurt. So these are for definitions. And what are the sections for punishment? For punishment, the sections are, for the punishment of hurt and grievous hurt, the main sections are 323, 324, 325 and 326. 323 gives punishment for hurt. 324 gives punishment for hurt by dangerous weapon. 325 gives punishment for grievous hurt. 326 gives punishment for grievous hurt by dangerous weapon. Okay. 326A and 326B, they are for throwing of acid. Throwing of acid on somebody. Easy. Now, types of abrasions. Let's discuss on the types of abrasions. So basically we can divide like this: abrasions caused by the horizontal force, then abrasions caused by the perpendicular force. Horizontal force, then further two categories. One is which has only length, other is which has both length and breadth. If only length is there, that is called scratch abrasion. So this is the first type. If both length and breadth are there, that is called grazed abrasion, also called brush burn. Okay, this is second type. Now, perpendicular force can be of two types. When the one is when the impact is of a longer duration, long duration impact. Other is when a small duration impact. Small duration impact. In the long duration impact, that will be called pressure abrasion. Small duration abrasion will be called impact abrasion or imprint abrasion. Example of pressure abrasion is ligature mark in hanging. Example of impact abrasion is tire mark. Okay, both pressure and impact abrasion, both of them, they produce a certain kind of pattern. So please remember, patterned abrasion is produced by pressure and impact abrasions. Okay, now there are certain conditions which are not abrasions, which can be confused with abrasion. There are three conditions mainly: end bite marks, diaper rash, and bed sores. These are the three conditions which can be confused with abrasions. Now, healing of abrasions and bruise. Healing of abrasion. When fresh, what is the color? Obviously, bright red. Okay. And scab formation occurs in how much time? That's very important. In 12 to 24 hours, scab formation occurs. So, bright red scab is formed. Bright red scab is formed in 12 to 24 hours. Then in 2 to 3 days, brownish black scab is formed. Sorry, reddish brown scab. Reddish brown scab. Reddish brown scab. Reddish brown scab is formed in 2 to 3 days. Then in 4 to 7 days, the scab becomes brownish black in color. Brownish black scab is formed. Three changes, basically you have to remember three changes which occur between 4 to 7 days. One is the scab becomes brownish black in color. Second is scab starts peeling from margins. Number third, new epithelium grows under the scalp. And more than 7 days, scab peels off completely, leaving a depigmented area which soon becomes pigmented. Leaving a depigmented area which soon becomes pigmented. Now, healing of bruise. When fresh, the bruise is reddish in color. In few hours to 3 days, it becomes bluish due to deoxyhemoglobin. Then, on 4th day, it becomes brownish due to hemosiderin pigment. On 5th and 6th day, it becomes greenish due to hematoidin or biliverdin pigment. On 7 to 12 days, in 7 to 14 days, it becomes yellowish due to bilirubin pigment. It becomes yellowish due to bilirubin pigment. Okay, so you can remember like this: abrasion heals in 1 week, bruise heals in 2 weeks. Easy to remember. Now, incision test. What is the purpose of incision test? Incision test is used to distinguish bruise from post-mortem staining. And bruise, so the true bruise can be confused with post-mortem staining, number one, and it can also be confused, true bruise can be confused either with the post-mortem staining or it can be confused with the artificial bruise. Okay, and to distinguish from the post-mortem staining, we do the incision test, helps to distinguish true bruise from the post-mortem staining. Artificial bruise can be produced by which irritant plants? Semicarpus, anacardium, calotropis, and plumbago. These are the plants which can be used to produce artificial bruise. Now, please remember, there are certain places where even a small force can produce large bruise, and on the other hand, there are certain places where even a large force will produce only a small bruise. So, this will have, so large bruise can be typically produced in the face, vulva, and scrotum. Please remember like this: large bruise, face, vulva, scrotum. Large bruise, face, vulva, scrotum. Now, coming to ectopic or migratory bruise, the most common is the raccoon sign or black eye, as shown in this photograph. Other is Bettel's sign, as shown in this photograph. Now, What are the places where you can find incised looking lacerated wound? When the wounds are lacerated but looking like an incision, you can find them over bony prominences. These can be found on the bony prominences. Example: scalp, forehead, okay, zygoma, iliac crest, okay, shin. Here you can find incised looking lacerated wound. On the other hand, lacerated looking incised wound can be found over, incised looking lacerated wound can be found over, when the wound is incised but looking like a laceration, over scrotum and axilla. Clear? Now, shape of the stab wound, basically three types of shape you should be knowing. One is the shape which is produced by a single edged knife. Second is the one which is produced due to a double edged knife. Third is the one produced by a pointed blunt object. Example: screwdriver. So if you remember, there were three kind of shapes by a single edged knife. Which were those three kind of shapes? The three kind of shapes were teardrop, like this, or fishtail, like this, or the third one was wedge shaped. Simply like this. Okay, these are the three shapes produced by the single edged knife. Double edged knife will produce the spindle shaped or elliptical, like this. Okay, the pointed blunt object will produce like this: irregular, round, irregular, round. Okay. Pape's rule is used to identify, to know the sequence of fractures. It helps to know sequence of fractures. Pape's rule. So pedestrian injuries of three types: primary impact injury, second is secondary impact injury, third is tertiary impact injury, also called secondary injury. So please remember, secondary impact and secondary injury are different. Primary impact injury, they basically are the most commonly they occur on legs, and other feature is bumper fracture. Bumper fracture is the fracture of tibia of both the legs. Secondary impact injury due to second hit by the object. Tertiary impact occurs due to an object other than motor vehicle, due to an object other than motor vehicle, most commonly ground. A characteristic feature of tertiary impact injury is extensive abrasions. Extensive abrasions. Okay. Now, injury to motor vehicle occupants. Injury to the front seat passenger, injury to the driver, injury to the front seat passenger, injury to the back seat passenger. Now, number one, the steering wheel impact, it will be seen only in driver. Then number two, sparrow foot marks. Sparrow foot marks which occur due to windshield glass injury, windshield glass injury. It can be seen in driver as well as front seat passenger, but not into the back seat passenger. Number third, seat belt injury. Seat belt injury will be seen in all, but the difference is seat belt sign will be on. What you have to know is how it is helpful. Let's come to the rapid revision of sexual offences. First of all, classification of sexual offences: natural, unnatural, and sexual perversions, also called paraphilias. The natural sexual offences are rape, incest, and adultery. Actually, adultery is now no longer an offense. Earlier it was defined under 497 IPC. Now it is no longer a criminal offense. Incest is sexual intercourse with a person related in blood. Now, example of unnatural sexual offenses are: number one, I will write here. Example of unnatural sexual offenses are: number one, sodomy, also called buggery. Number two, tribadism, also called lesbianism. Number third, buccal coitus, also called sin of Gomorrah. And the fourth is bestiality. Bestiality is sex with animals. Okay. Sexual perversions I will tell you as we move along. Now, coming to the, this is about the classification of sexual offenses. Now, a few important laws on sexual offenses. Basically, if I talk about laws of sexual offenses, we can broadly classify them into sexual assault other than rape, and the second is rape. For sexual assault other than rape, we basically remember the IPC 354. Okay, and then we have subsections like 354A, 354B, 354C, 354D, and 509 also. Okay, so here my way of remembering is I have made a small funny mnemonic. I think that can help you also. CVDS. So 354C is for voyeurism. CV, and DS. 354D is for stalking. Okay. 354A is for sexual assault. 354A is for sexual harassment. So in sexual assault, you use a proper force to sexually assault somebody. In sexual assault, you may not be using force, but you like inappropriately touch somebody. That will be sexual harassment. 354B is removing the clothes without consent. Removing clothes without consent. 509 is eve teasing. Okay, it's just like eve teasing. For rape, 375 defines rape. And if you remember earlier, the definition of rape was only insertion of penis into vagina. Now it has been broadened up. Insertion of penis into mouth, anus, urethra, or even insertion of some object into urethra, anus, vagina. So now the definition of rape has been broadened up. Minimum age at which a girl can give consent for sexual intercourse is now increased to 18 years. Earlier it was 16 years. Now this has been increased to 18 years, whether married or unmarried, in both the cases. 376 gives punishment for rape, and 376 is giving punishment for rape. But then there are subcategories also. Like in 354, we have categories 354 A, B, C, D. Similarly, in 376 also we have subcategories. Let's discuss those. So first of all, please remember, as per 376, minimum punishment for rape will be 10 years. This is what you have to remember. The minimum punishment for a rape, any kind of rape, the minimum punishment is 10 years. In certain conditions, you can have even more minimum punishment, but this is as such, there is no punishment below this, below 10 years. Now, 376 gives the general punishment for rape. Then we have 376A, 376AB, 376B, 376C. We have 376D, 376DA, 376DB, and 376AE. So, how do you remember this? First of all, you remember like this. Death punishment can be given in 376A and 376E, first and last. In 376A, the woman goes into death or into the comatose state. In 376E, it's a repeated offense by previous convict. Earlier, he committed rape on a woman. Now, he is also committing rape. He's coming out and again committing a rape. So, in these two conditions, death punishment can be given. 376A and 376E. 376A, woman goes into the state of coma. 376E, repeated offense. Now, 376B is sexual intercourse by husband with wife. How to remember? B for bride. So, husband, wife. This is how you can remember. 376 is sexual intercourse by a person in authority. So, it is not properly a rape. The person is not forcing, but somehow using the influence of his power, though he is not properly actually raping a person, a girl, but using the influence of his power. 376C. And whenever the word D comes in front, whether it is D, DA, or DB, these three are for gang rapes. Gang rape is when more than one person is involved in raping the girl. Okay, 376E we have already discussed. 377 is unnatural sexual offenses. Example, homosexuality, with consent, it is no longer an offense. Okay. Similarly, adultery is also no longer a criminal offense, though it can still be a ground for divorce. Okay. Now, coming to different kinds of hymen, this is the most common type. What do you call it? This is the semilunar. Semilunar is the most common type, also called crescent shaped. Here, the opening is placed anteriorly. The hymen is crescent shaped. The hymen is crescent shaped, placed posteriorly, and the opening is placed anteriorly. Central opening, another is central opening. This is also called annular hymen. Then this is number third. This is septate hymen with two lateral openings. This is cribriform, multiple small openings. This is microperforate, very small opening. And number sixth, this is imperforate, no opening at all. Now, 7, this is very important. This is denticular hymen, also called fimbriate hymen. What's the significance of this hymen? It can be confused with tears. It has natural notches which can be confused with tears. So a hymen is, when does the hymen gets ruptured? After the first sexual intercourse. And hymen gets ruptured at what position? Between 5 o'clock to 7 o'clock position. That is posterolateral. So hymen get ruptured at posterolateral position after the first sexual intercourse, and after that the major rupture of hymen occurs after the childbirth. After the childbirth, only remnants of hymen remain. Only remnants remain. That is called carunculae myrtiformis. Okay. Now, hymen in virgin versus hymen in non-virgin. In virgin is a girl who never had sex. In hymen, in virgin is usually intact, and it's in non-virgin it is usually ruptured. But there are certain exceptions. That means the girl is virgin, but still the hymen can be ruptured. For example, by falling on a long object, then masturbation, gynecological operations, etc. Okay. So but please remember, hymen does not get ruptured by cycling, jumping, or horse riding. or routine sports. Generally, by routine sports, it does not get ruptured. In a non-virgin, another exception is the girl is non-virgin, but still the hymen is intact. This is called false virgin. This is called false virgin. It will occur when there is a large central opening or when there is a large opening, or the hymen is very elastic or fleshy. In that cases, even after sexual intercourse, the hymen may not rupture. That is called false virgin. Now, few other facts. Glacier Keene rods, it is a glass rod used to visualize hymen. It's a glass rod used to visualize hymen inserted into the vagina. It is a source of blood. Then Lugol's iodine and Pap stain, these are used to detect vaginal epithelial cells from the glans penis of rape accused. They are used to detect vaginal epithelial cells from the glans penis of rape accused. Toluidine blue dye is used to see recent micro injuries on genitalia. Recent micro injuries on genitalia. Smegma gets deposited in 24 hours on glans penis. So if smegma on glans penis, if it is present, it indicates no sexual activity for past 24 hours. If it is absent, it indicates either sexual activity in past 24 hours or cleaning of private parts have been done in past 24 hours. Now, few things characteristic for a habitual passive agent in sodomy. Remember three things. There will be loss of, due to repeated sodomy, there will be I'm talking about the passive agent. There will be loss of normal folds around the anus. The skin will become thick and smooth. And the last is lateral traction test will be positive. So please remember, lateral traction test is used to identify habitual passive agent in sodomy. Who is a catamite? C for catamite, C for child. So catamite is a habitual passive, is a child who is a passive agent in sodomy. Child who is a passive agent. Child who is a passive agent in sodomy. Okay. Dyke or butch is this is a term used for masculine female. This is the term used for masculine female in lesbianism. Okay, also called active partner. Femme is the term used for feminine female in lesbianism, also called passive partner. The buccal coitus can be of two types, fellatio and cunnilingus. Fellatio is oral stimulation of penis. Cunnilingus is oral stimulation of vagina. Bestiality is sex with animals. Okay. Now, coming to sexual perversions or paraphilia, sexual sadism is getting gratification by beating the partner. Then, sexual masochism is opposite of sadism, that is getting gratification by being beaten up by the partner. Voyeurism is watching a person, watching a female engaged in sexual activities. Voyeurism. Exhibitionism is displaying the private parts in public. Frotteurism is rubbing the private parts in crowded places, rubbing the private parts with body of another person in crowded places. Necrophilia is having sex with dead bodies. Necrophagia is eating of dead bodies. Fetishism is getting gratification by objects of opposite sex. Example: footwear, undergarments. Transvestic fetishism is getting gratification by wearing the clothes of opposite sex. So please remember, actually in both transvestic fetishism as well as transvestism, in both of them the person wears the clothes of opposite sex. But the difference is, in transvestic fetishism, the person is wearing the clothes of opposite sex for the purpose of sexual gratification. And in transvestism, he is wearing the clothes of opposite sex because of some gender identity disorder. Okay, so fetishism, so transvestism may not be a sexual perversion. Transvestism may not be a sexual perversion. But please apply your minds in a look at other options also, because sometimes some examiners consider both transvestism and transvestic fetishism as the one and the same thing. Okay, so accordingly you will have to look at the other choices and accordingly mark the answer. Pedophilia, as the name suggests, having sex with children. Now, sexual asphyxia or autoerotic asphyxia, here what's the manner of death? Accidental. And which are the two perversions associated with sexual asphyxia? The two perversions associated with sexual asphyxia are masochism and transvestic fetishism. Okay, so this was about our rapid sexual offenses. Questions are very commonly asked. I hope this helps. Now, coming to infanticide and child abuse. The terminology should be simple and clear. Infanticide is killing of any child below the age of 1 year. Feticide is killing of the fetus inside the uterus. Killing of the fetus inside the uterus. And filicide is killing of the child by parents. killing of child by parents. Now, deadborn, who dies in the deadborn is like intrauterine death, dies in the uterus before the process of labor has started. Stillborn is during the labor. Also, to be called stillborn, the gestational age should be less than 28 weeks. To be called stillborn, the gestational age should be less than 28 weeks. Liveborn is who shows any signs of life. Viable fetus is any fetus more than 210 days of age, or maybe you can just remember 28 weeks. Actually, it is 30 weeks, 28 weeks. That can be confusing. So just remember like this. Different books say different things. And any fetus who is more than 28 weeks of age, any fetus is considered a viable fetus. What are the signs of deadborn? Basically, there are three signs of deadborn. The deadborn signs are: number one, rigor mortis at birth, because fetus died long time back in the uterus itself. So at the time of birth, there will be rigor mortis. Number two is maceration, also called aseptic autolysis. This is the most common type of decomposition. This is the most common type of decomposition. And then usually maceration occurs. Rarely what happens is mummification occurs. Rarely mummification occurs. Now, in maceration, what are the signs of maceration? The earliest sign of maceration is skin slippage. It occurs in about 12 hours. Earliest radiological sign of maceration is Roberts sign. Roberts sign is presence of gas shadow in blood vessels. Other important radiological sign is Spaldic sign. This is Spaldic sign. Spaldic sign is overlapping of skull bones. It can occur anywhere between 2 to 5 days after death. It can occur anywhere between 2 to 5 days after death. And let us do a rapid revision of a very important topic: firearms and bomb blast injuries. So as you know, the type of firearms, two types: rifled and smoothbore. Rifled firearm example: rifle, revolver, pistols. Example of smoothbore, just remember, shotgun. Rifled firearm uses bullets, whereas smoothbore firearm uses small pellets. Okay, now coming to the component of the cartridge, what you have to remember is, if we talk about the cartridge, cartridge of a rifled firearm, cartridge of a smoothbore firearm, both has the cartridge case. both have cartridge case. Number 2, both have primer, both have gunpowder, both have gunpowder, both have cartridge case, both have primer, both have gunpowder. In projectile, rifle has bullet, smooth bore has pellets. And the other thing is, which is present only in smooth bore, is wad, which you remember is a soft plastic material which hold together the pellets. Okay. Now, another thing that you have to remember is, what are the components of primer? Remember the mnemonic, blast is the component of primer. Barium nitrate, lead stiffenate, antimony, sulfide and tetrazine. Now coming to gunpowder, gunpowder is of two types, black gunpowder and smokeless gunpowder. Black gunpowder has, remember the mnemonic PCS. Black gunpowder has potassium nitrate, charcoal and sulfur. Smokeless gunpowder is of three types, single base, double base and triple base. Single base has nitrocellulose. Double base has nitrocellulose plus nitroguanidine. And triple base has nitrocellulose, sorry, just a second. Single base has nitrocellulose, double base has nitrocellulose plus nitroglycerine. And triple base has nitrocellulose plus nitroglycerine plus nitroguanidine. Okay. Single base only nitrocellulose, double base nitrocellulose plus nitroglycerine, triple base nitrocellulose plus nitroglycerine plus nitroguanidine. Okay. Now, if we have to, on the basis of firearm wounds, if we have to calculate the distance can be calculated by two means, if you remember. One is by the presence of absence of singeing, blackening, tattooing, etc. Other is by the shape and size of the wound. So, number one, there are two methods to calculate the distance. Now, on the basis of singeing, blackening and tattooing, how will you calculate? So, we can divide the distance here into four categories. One is tight contact. Other is loose contact, or other is, you can say, loose contact or close contact. Third is intermediate range. Fourth is distant range. Okay. In tight contact, what happens is, all features, singeing plus blackening plus tattooing are present, but just on the margins. Just on margins. This is important. Remember, not around the wound, just on the margins. In loose contact or close contact, all singeing plus blackening plus tattooing are present around the wound. In intermediate range, only tattooing is present around the wound. And distant range, nothing is present around the wound. So these are the characteristic features. So again, if you see here, this is close range, this is intermediate range. Okay. Now on the basis of size and shape, if you have to calculate the distance, please remember that in case of a rifled firearm, the wound will always be either round or oval. Wound will always be either round or oval. Whereas in smooth bore, it will depend upon the distance. It will depend on distance. Okay. So what happens is up to 30 centimeters, a round wound is produced. Up to 30 centimeters, a round wound is produced. After 30 centimeters to 2 meters, the pellets slightly start spreading out. So a rat hole wound is produced. Rat hole. So please remember, rat hole wound is a characteristic feature of a smooth bore firearm. Then from 2 meters to 4 meters, there will be one central wound like this, and few satellite wounds will also be seen. Satellite wounds. So please remember, satellite wound is a feature of also smooth bore firearm after 2 meters to 4 meters. After 4 meters, if it is more than 4 meters, if it is more than 4 meters, then only individual pellet wounds are produced, no central wounds. Okay. And apart from this, few other things that I would like to tell you is one characteristic feature is in case of a contact or a close contact wound on scalp, the gases go inside and produce a blast effect. So what happens is here large cruciate shaped or stellate shaped wounds are produced like this. Okay, and sometimes complete bursting of skull can also occur. These two are especially the features of a contact or close contact wound on the scalp. The large cruciate shaped, or this is commonly seen in the rifled firearm wounds, and this is more commonly seen in the shotgun wounds. Okay. Now, entry wound versus exit wound. Please remember that normally entry wound is small and exit wound is large. What is the except? Okay. What is the except? And also one more thing. Normally the entry wound is small, clean. Large its exit wound is large, irregular. But what is the exception? The exception is contact or close contact wound over the scalp. Here, as I told you, like this, here the wound can be large, irregular, cruciate shaped, or stellate shaped. Okay, this is the exception. In case of a contact or a close contact wound, the wound can be cruciate shaped or stellate shaped, so it can be larger and irregular, just like the exit wound. So in this scenario, so in contact or close contact wound on scalp, here the entry wound can look like, can be confused with exit wound. Please remember. Then, please remember that abrasion collar, grease collar, singeing, blackening, and tattooing, these all are the features of entry wound, not the exit wound. Except rarely abrasion collar may also be seen in exit wound. Okay. So this is about the entry versus exit wounds. Now coming to the type of bullets, dum-dum bullet is a bullet which expands on hitting the target, Frangible bullets is a bullet which breaks into multiple pieces. Okay. Tandem bullet or piggyback bullet is a bullet where due to a defect in the firearm, it occurs due to a defect. Initially the bullet does not goes outside, but when it is fired again, it is go outside again. So tandem bullet is, in tandem bullets, 2 bullets come out. In duplex bullet also 2 bullets comes out. But what is the difference? Tandem bullet is due to some defect in the firearm, whereas duplex bullet is by design. It is by design. In tandem bullet, both the bullets go one after the another. So they enter through the same, they can enter through the same entry wound. Whereas duplex bullets will enter through the different entry wound. For example, this is the cartridge. You place the bullet, both will come out and enter the different entry wounds. Souvenir bullet is a bullet which remains inside the body and cannot be removed. Incendiary bullet is a bullet which produces fire on hitting the target. They have phosphorus in them. And they produce fire. Tracer bullet is a bullet whose path can be traced out. For example, if the bullet is fired, then it produces certain chemicals because of which a color is produced and its path can be traced out. Ricochet bullet is a bullet which hits some other target before, whose path changes after hitting it particular target. That is called ricochet bullet. Yawning bullet is a bullet which has irregular path, like this, which has an irregular path. Tumbling bullet is a bullet which rotates end to end. Like initially it's going like this, then it will go 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 like this, which is rotating end to end, is tumbling bullet. Okay. Now, tests to detect gunshot residues. Remember the mnemonic: hands. Harrison-Gilroy, atomic absorption, neutron activation, dermal nitrate, scanning electron microscopic, dispersive X-ray spectrometry. What you have to remember is all of them, they detect heavy metal components except one of them. This is also detecting heavy metal. This is also detecting heavy metal. This is also detecting heavy metal component of the gunshot residue, and this is also detecting heavy metal component of the gunshot residue, except this dermal nitrate. Okay, it is detecting the nitrate component. It is not detecting the heavy metal component. It is not detecting the heavy. So all of them detect the heavy metal component except the dermal nitrate test. Okay, bomb blast injuries to 4 types: primary blast, secondary blast, tertiary blast, quaternary blast. Primary blast injuries, they occur due to blast wave or a high pressure wave. They occur due to a high pressure wave. Okay, in air blast, the most common organ injured is tympanic membrane, followed by lungs, followed by GIT. Tympanic membrane, followed by lungs, followed by GIT. In underwater blast, the most common organ injured is GIT. Okay, and due to the primary blast, basically the hollow organs are most commonly injured. Hollow organs like intestine, lungs, and all. Solid organs are not injured. Solid organs are not injured due to primary blast. Solid organs not injured due to primary blast. Secondary blast occur due to flying of small objects. Flying of small objects like pieces of stones and pieces of bomb particles. It's the most deaths occur due to secondary blast injury. It causes characteristic Marshall's triad. It causes characteristic Marshall's triad, which is also called peppering. So what occurs in Marshall's triad? There is multiple small punctate abrasions, lacerations, and contusions, like this, as you can see in this photograph. This is the most characteristic of bomb blast injury. Tertiary blast occurs due to high pressure, high velocity. The victim himself is blown away and hits some distant object. The victim itself is blown away and hits some distant object. Quaternary blast, it includes all other injuries which are not included in first three. For example, injuries due to flash burns, injuries due to gases, respiratory injuries due to gases, traumatic asphyxia due to collapse of buildings, traumatic asphyxia due to collapse of buildings. Okay. Hi friends, so now let us start the rapid revision of toxicology. Okay, so if I have to start with the revision of toxicology, I will start with toxidromes. And as you remember, there are basically how many toxidromes? 4 toxidromes. One is the CNS depressants. The second is Tell me, and this the sympathomimetics. Second is sympathomimetics. Opposite of CNS depressant, sympathomimetics. Opposite of CNS depressant. Then similar to sympathomimetic, anticholinergic. Then opposite of anticholinergics, cholinergics. So what is the main feature of CNS depressants? Main features of CNS depressants, all depressed. Main feature of sympathomimetics, agitated. Anticholinergics, dry. Cholinergics, leaking person, leaking from everywhere. What are the common CNS depressants? The common CNS depressants are ABBO. Remember? ABBO. A for alcohol, B for barbiturates, B for benzodiazepines, O for opiates. And what are the common sympathomimetics? Remember the mnemonic set, plaque. S for sympathomimetics. Sorry, S for salbutamol. S for salbutamol. E for ephedrine. T for theophylline. P for phencyclidine. L for LSD. A for amphetamines. And C for cocaine. Okay. Now, what are the anticholinergics? Anticholinergic. All antis are anticholinergics, like antipsychotics. Example, chlorpropamide and all. Then antidepressants, especially which one? Tricyclic antidepressants. Then antihistaminics, which one? Especially the first generation antihistaminics. Then anti-Parkinsonian drugs. And then most important, atropine, classically present in dhatura. Classically present in dhatura. Okay. Now, examples of cholinergics. Remember the mnemonic D-Monk. D for donepezil. E for adrophonium. E for adrophonium. M for mushrooms. O for organophosphates. Very, very important. OPCs, that is organophosphates. N for nicotine. C for carbamates. C for carbamates. D-Monk. Okay, so this is the mnemonic for cholinergics. Now, what are the main features? So, in an antidepressant, in CNS depressants, typically what are you going to find? All depressed. So, vitals depressed, respiratory center depressed, blood pressure depressed, and typically, if you see that a typical characteristic feature of opiate poisoning is all pinpoint pupil, very low BP, very low heart rate, and very low respiration. comatose person. This so maximum CNS depression by opiates. CNS depression will be caused by all alcohol, barbiturate, benzodiazepine, opiates, but maximum by opiates. All depressed kind of person. Sympathomimetic is opposite, agitated person. So it will be dilated pupil. Dilated pupil. So if you have to write dilated pupil, then the person is agitated. So increased vitals and all. Okay, so that is the reason in cocaine you see myocardial infarction and high blood pressure and all these things. In anticholinergic 80% features are similar. Okay, here also dilated pupils. Here also you will have dilated pupils. Here also, like in sympathomimetic, here also you will have increased vitals. Okay, so many of the features are similar in both. But what's the main difference? The main difference is here in sweating is present in which one? Sympathomimetic or anticholinergic? Remember the word. Anticholinergic means dry. That is the main word. So sweating is, please remember, present in sympathomimetic but absent in anticholinergic. That is one main feature difference. The another main feature is in sympathomimetic, because of the vasoconstriction, there the the skin is pale, whereas in anticholinergic it is flushed, reddish. So these are the two. So most of the features of sympathomimetic and anticholinergic are similar. These two are the exceptions which are different in both. And because, so remember the word dry for anticholinergic, so it is constipation or diarrhea? Constipation. Urinary retention or urinary incontinence? Urinary, tell me, retention. Now, cholinergic, the classical thing is that you have to remember is leaking person. So, leaking person means, so I will write here the features of cholinergic. Dumbbells. Remember this simple mnemonic. Dumbbells. D for diarrhea. Diaphoresis. U for urination. M for meiosis. B for bradycardia. Bronchial secretions increase. E for emesis and excitation of skeletal muscles. L for lacrimation. S for salivation. Okay. Now, if we talk about coming to the next point. So, this is the important toxidromes. In CNS depressants, as I told you, there is mainly alcohol, barbiturates, benzodiazepines, and opiates, A, B, B, O. So, I will talk more about these now CNS depressants. In alcohol, I will especially like to talk about methyl alcohol and ethylene glycol. In methyl alcohol, the characteristic feature is ocular feature, blurring of vision, blindness, all these things. In ethylene glycol, the classical feature is hypocalcemia features, that is tetany, paresthesias, etc. And calcium oxalate crystals in urine. So these are the characteristic features of methyl alcohol and ethylene glycol poisoning. Please remember, the same features which are seen in ethylene glycol poisoning are also seen in oxalic acid poisoning. Why? Because oxalic acid is actually a metabolite of ethylene glycol. Okay, so both ethylene glycol as well as oxalic acid will show these features. Now, if we talk about the treatment of methyl alcohol and ethylene glycol, please remember, for both methyl alcohol as well as ethylene glycol, the main treatment is either you can give ethyl alcohol or you can give fomepizole, that is 4-methyl pyrazole. This is the main, so either of them can be given for either of them, that is the main treatment. Another thing is for the benzodiazepines, what is the antidote? Flumazenil. For opiates, please remember, for the toxicity, the treatment is naloxone. And for withdrawal symptoms and de-addiction, for withdrawal symptom and de-addiction, what do we give? We give either methadone or buprenorphine, either one of them, plus naltrexone. Okay, this is called for withdrawal or de-addiction. And opium, please remember, is obtained from it is a dried juice of unripe capsules of poppy plant, that is Papaver somniferum. Papaver somniferum. Now, in coming to sympathomimetics, what was the mnemonic? Set plaque. Here especially I would like to talk about the cocaine poisoning. In cocaine poisoning, please remember the acute and chronic poisoning. Now, because it is a sympathomimetic poisoning, so the typical features is increased blood pressure, increased heart rate, increased body temperature, increased respiratory rate, and sometimes the blood pressure is so increased that it can also, and the heart rate is so increased, it can also lead to myocardial infarction and sudden death. Okay, you must have heard of that. In chronic poisoning, the typical classical features are: number one, tactile hallucinations, also called cocaine bug, also called Magnan symptoms, also called formication, the second is the tongue and teeth, they become black in color in cocaine poisoning. Now please remember, In sulfuric acid poisoning, tongue is black, but teeth are chalky white. In sulfuric acid poisoning, tongue is black, but teeth is chalky white. Now, what is speedball? Speedball is a combination of heroin plus cocaine. Okay. Now, coming to in anticholinergics. So this is sympathomimetic cocaine. In anticholinergic, I will especially like to speak about Dhatura. Dhatura is also called rail platform poison. Okay. Dhatura resembles which seeds? It resembles chili seeds, capsicum seeds. How do we differentiate Dhatura seeds versus capsicum seeds? Dhatura seeds are larger, brownish, and capsicum seeds are smaller, yellowish. Dhatura seeds are round. Capsicum seeds are kidney shaped. Sorry, opposite. Dhatura seeds are kidney shaped. Capsicum seeds are round. Okay. Typical feature of Dhatura poisoning is it causes delirium. So, because Dhatura is an anticholinergic, blood pressure increase, heart rate increase, sweating. You know, two features differentiating between cholinergic and anticholinergic and sympathomimetic: sweating and flushed face. Okay, delirium is a typical feature of anticholinergics. Now, cholinergic, the most important one is the organophosphates. Now, please remember, in organophosphates, you have to remember, like, these are also these are most important cholinergics. Why? Organophosphates and carbamates, because these are commonly used as insecticides and pesticides. So here you will have to remember so these are the insecticides. Organochlorines are also insecticides. So these are the insecticides which are commonly the questions are asked. Organophosphates and carbamates, very important. Organophosphates, further two types, alkyl and aryl. Carbamates, organophosphates, please remember, are all irreversible inhibitors. All irreversible inhibitors. Carbamates can be either reversible or reversible. So this is easy to remember. Wherever you see carb, either in front or back, that will be carbamate. Or you see like pheostigmine, neostigmine, these are also carbamates. Examples of organochlorines, please remember, whenever it is ending in Ne or In, Ne or In, that is an organochlorine. Poisons which delay putrefaction. Which were the poisons? Jackass, zinc, antimony, carbolic acid, arsenic, and strychnine. These are the poisons which delay putrefaction. Now, color of the postmortem staining is something that you have to remember, you have to rectify. Very, very important table that we have already given you. Okay, this is the color that you have to rectify. Similarly, smell you have to rectify. Garlic like smell is very commonly asked. Remember the mnemonic TOPA. TOPA. So garlic like smell is seen in thallium, organophosphate, phosphorus, and arsenic. TOPA. Okay, please remember this mnemonic term. Garlic like smell, TOPA. Thallium, organophosphate, phosphorus, and arsenic. Fruity cane. Fruity cane. C for chloroform, A for acetane, N for nicotine nitrite, E for ethanol. Okay. Now, the poisons which are hepatotoxic and nephrotoxic. For hepatotoxic, what was the mnemonic? Cap, tap, zap. Remember the mnemonic? Cap, tap, and zap. Cap, tap, zap is hepatotoxic. Nephrotoxic, Tamzoc. Nephrotoxic is Tamzoc. Nephrotoxic poison is Tamzoc. Remember like this. Now, contraindications of. So you have to, and when it comes to, please remember, you have to remember the contraindications of gastric lavage and activated charcoal. Contraindications of gastric lavage are very easy to remember, I think. Number one is all corrosives except carbolic acid, because it makes the stomach wall hard and leathery. Number two, convulsive poison. Okay. Number three, comatose patient. Number fourth, volatile poisons like kerosene. The fifth, hypothermia. Then esophageal varices. Now, what are the conditions in which activated charcoal does not have to be used? The conditions where activated charcoal, remember the mnemonic? HACO. Okay. Heavy metals, alcohols, carbamates, corrosives, organophosphates. So these are the conditions where activated charcoal does not have to be used. HACO. Now, universal antidote. What's the universal antidote? ATM. Please remember, A for activated charcoal. To absorb most of the poisons. T for tannic acid. And M for magnesium oxide. M for magnesium oxide. Coma cocktail, DNB. Remember the mnemonic DNB. D for dextrose. N for naloxone. B for vitamin B1. B for vitamin B1. Alkaline diuresis, BCMS. B for barbiturates. C for chlorpropamide. M for methotrexate. S for salicylates. Acidic diuresis is not done in any case. Please remember, it's because it is harmful. Hemodialysis, simple mnemonic. What was the mnemonic? Heavy blast can be treated by dialysis. Heavy blast can be treated by dialysis. Charcoal hemoperfusion, BST C3P3. BST C3 PS3 P3 BST C3 P3. Now these antidotes, this should be easy to remember. Paracetamol, N-acetylcysteine. Methyl alcohol, I already told you. Benzodiazepine, flumazenil, already told. Cocaine, cocaine is a sympathomimetic. So what will you give? You will give a CNS depressant like benzodiazepine to control the BP, sugar, to control the agitation and seizures and all. Anticholinergic, the antidote will be the anticholinergic, the antidote will be a cholinergic drug like physostigmine. Okay. Isoniazid, so carbon monoxide, 100% oxygen, isoniazid, pyridoxine, heparin, protamine sulfate. Now, chelating agents. Basically, we know that chelating agents are used for heavy metals. There are main 6 chelating agents. First, what you have to remember is the first 3, BAL, DMPS and DMSA, divided into 2 categories, and the below 3, calcium EDTA, penicillamine and desferrioxamine. The first 3 are used for multiple heavy metals: arsenic, mercury, as well as lead. So that means BAL can also be used for all 3. DMPS can also be used for all 3, arsenic, mercury and lead, and DMSA can also be used for all arsenic, mercury and lead. Now the below 3, they are used for single. Calcium EDTA for lead, penicillamine mainly for copper, desferrioxamine mainly for iron. Now coming to viscera preservation. In viscera preservation, first of all, we look at the type of viscera preserved. In type of viscera preserved, it can be either routine viscera, which is preserved in all the poisons, or special viscera, which is so routine viscera is preserved in all poisoning conditions. Special only in specific poisons. So all poisons. So what is the routine viscera? Routine viscera is stomach, small intestine, portion of small intestine, portion of liver with gallbladder, spleen, half of each kidney. Okay, these are the things. Then blood, urine, these are the things always preserved. Then there are few things which are preserved only in specific conditions, like brain. Remember the mnemonic BOSCA. Barbiturates, organophosphates, opiates, strychnine, carbon monoxide, cyanides, and alcohol and anesthetics. Spinal cord, gelsomine and strychnine, CSF, alcohol. Vitreous, I think it's not visible. Vitreous is alcohol and chloroform. Vitreous, I will write here. Vitreous is alcohol and chloroform. Lungs, same, almost similar. Gaseous poisons, alcohol, chloroform. Bile, COB. Remember the mnemonic COB. COBH. COB. Okay. Then fatty tissues, pesticides and insecticides. Skin, injected poisons. Bones, hairs and nails. Heavy metals, especially arsenic. This was about the organs which are preserved in viscera. The type of organs preserved. Now, second thing is the type of preservative used. The type of preservative used, please remember, it can be different preservative for viscera versus preservative for body fluids. For viscera, basically 2 are the main kind of preservatives used. One is either saturated solution of common salt and second is rectified spirit. Please remember that both of them can be used for most of the poisons. Okay. Please remember, we are talking about the preservatives for toxicological purposes. For toxicology, for viscera, we use 2 preservatives. Most of them can be used for most of the poison. Saturated solution of common salt as well as rectified spirit. Saturated solution, but you just have to remember few conditions where they are not to be used. Saturated solution of common salt, they can be used almost in all the poisons except corrosives. except corrosives. Okay, it can be used in except carbolic acid. So please try to understand what I am saying is saturated solution of common salt is not used in corrosives, but it can be used in carbolic acid because carbolic acid is an exception where it can be used. So saturated solution of common salt cannot be used in any corrosive, but it can be used in carbolic acid. Rectified spirit cannot be used in, remember this mnemonic, papa, formal, clothes, something like that. You remember papa, formal, clothes. Rectified spirit is not to be used in papa, formal, clothes. Okay. For body fluid, whether it is blood, urine, or anything, the preservative to be used is sodium fluoride. Please remember, for all, whether it is blood, urine, vitreous, the preservative to be used is sodium fluoride. In addition, if it is blood, then in addition to sodium fluoride, you will also use an anticoagulant, that is potassium oxalate. If it is blood, then in addition to sodium fluoride, you will also use potassium oxalate. If it is urine, then in addition you can also use thymol. For virological examination, you use 50% glycerol. 50% glycerol. Okay, now coming to corrosives, which is more corrosive, acid or alkalis? Alkalis. How do you remember this? And which is the most corrosive acid? Sulfuric acid. Which is the type of necrosis caused by alkalis and acids? In alkalis we have L, in acids we have C. So very easy to remember. In alkalis cause L for liquefactive necrosis. So liquefactive necrosis, so it injures till deep. Okay, the injury occurs till deep. Liquefaction occurs. So deep means more dangerous. Acid, C for coagulative necrosis. Coagulative necrosis. So coagulation is, it becomes hard. So less deep. Less deep means less corrosive as compared to alkali. Which is most affected? Now, easy way to remember is alkali is more corrosive. So as soon as we take it, the esophagus gets ruptured. It may not be the actual scenario, but this will help you in remembering that alkalis are more corrosive. So as soon as you take alkali, the esophagus get ruptured. So esophagus is more commonly ruptured in alkalis, whereas acids, they go till stomach. They are able to go till stomach and then they cause the rupture. So stomach is more commonly ruptured in acids. This may not be the actual phenomena, but this is how you can remember. Alkali is more corrosive, immediately go and rupture the esophagus. Acids go till down and cause more damage to the stomach. Chalky white teeth, sulfuric acid. Yellowish discoloration of tissues, nitric acid. Okay. Boiled lobster, B for boiled lobster, B for boric acid. Boric acid. Whole skin becomes reddish, erythematous, okay, reddish. The whole skin becomes reddish. Inflammation. Hypocalcemia and calcium, the two poisons basically I have already told, either ethylene glycol or oxalic acid. Either ethylene glycol or oxalic acid. Euchronosis. What is euchronosis? Blackish discoloration of tissues, cartilages. Okay, these three are the features of euchronosis. Green colored urine, leathery stomach are the features of phenol, that is carbolic acid. Now, coming to arsenic, toxicokinetics. Arsenic gets, as soon as you take arsenic, arsenic gets distributed to most of the tissues. But so it can be found in most of the tissues, except it is not found in blood, because it gets rapidly distributed from blood to other organs. And second thing is, it is not found in brain. It doesn't go to the brain much. Highest concentration is found in liver, followed by kidney. And for prolonged period, it can be found in keratinized tissues. That is skin, hair, nail, bones, etc. Okay. Acute arsenic poisoning. And now arsenic poisoning, both are important, acute and chronic. Acute poisoning, very simple because it's a GI irritant. Basically, it causes GI features and resembles cholera. Okay. Diarrhea, bloody diarrhea, profuse diarrhea occurs. Stomach, it causes red velvety stomach, which is characteristic. Chronic features are very important, especially peripheral neuropathy occurs. Which kind? Motor, sensory, or mixed? Please remember the neuropathy is mixed neuropathy. Both motor and sensory nerves are affected, but sensory nerves are affected more than the motor nerves. Both are affected, but sensory nerves are affected more than the motor nerves. So there is paresthesias, tingling sensations, and all these. Please remember, in case of lead, there is pure motor neuropathy. Okay. The skin symptoms are characteristic. What are the features? It causes hyperkeratosis of palm and soles, raindrop pigmentation, in nails there is Eldritch Maze lines. Hairs, please remember the mnemonic. Remember the mnemonic. What was the mnemonic? If you remember, hair on mat. That means alopecia. Alopecia is seen in M for mercury, A for arsenic, T for thallium. Hair on mat. Alopecia is seen in mercury, arsenic, and thallium. Blackfoot disease. It is characteristic of arsenic poisoning. Arsenic can cause malignancy of almost any body part, but especially kidney, urinary bladder, lungs, etc. Skin, most important, skin. It can cause skin, lung, kidney, bladder, and so these are the malignancies most commonly caused, but it can virtually cause for any one of them. Now, these are the tests specifically used to detect arsenic: Marsh test, Range test. NAA is neutron activation analysis. AS is atomic absorption spectrophotometry. Okay, atomic absorption spectrophotometry. Please remember, these two are basically used to detect heavy metals: neutron activation analysis, atomic absorption spectrophotometry. So not only arsenic, they can be used to detect other heavy metals also. Range test and Marsh test. So that is remember, if you remember, in gunpowder residues also, if we have to detect the heavy metal part of the gunshot residue, we use these two tests: neutron activation analysis and atomic absorption spectrophotometry. The Marsh test and Range test are specific for arsenic. Now, mercury poisoning, again, acute and chronic. Acute poisoning will be mainly the GI features: So acute poisoning can be divided into first phase and second phase. The first phase is like the metallic taste, the mouth, tongue become corroded, the burning pain, bloody vomiting, bloody diarrhea. So all GI features. Then later on, glossitis, gingivitis, renal tubule necrosis, and membranous colitis. So what happens is here mainly you can see the GI features are occurring in the first phase. Obviously, they are all heavy metals are GI irritants, and they later on the renal features are also occur in the second phase of acute poisoning. So acute poisoning can be divided into two phases. First phase, second phase. First phase GI features predominate. In the second features, the renal features predominate. Now, chronic poisoning features are very, very important. The tremor, there are specific different terminologies for tremor that you should know. Hetter's shakes, then glass blowers shakes, okay, Hetter's shakes, glass blower shakes, then concussio mercurialis. Concussio mercurialis is the last stage, actually, when the tremors are spread to whole of the body and person is not even able to perform any task. This is also called shaking palsy. And also another name for these tremors is Danbury tremors. So by and large, all these terms, Hetter's shakes, glassblower shakes, Danbury tremors, concussio mercurialis, or shaking palsy, they represent tremors. Concussio mercurialis and shaking palsy represents more advanced form of tremors, more advanced form. Then gingivitis is a classical feature. Blue line on gums. Please remember, blue line on gums actually is seen in lead. I will write here. Now, this is interesting. Blue line on gums typically seen in lead poisoning, but can also be seen in MCI. Typically seen in lead poisoning, but can also be seen in M for mercury, C for copper, I for iron. I for iron. Then erethism, Mad Hatter, the neuropsychiatric symptoms appear, the various psychological issues occur. Mercurial lentis is a deposition of brownish colored mercury vapor on which part of the eye? Lentis. Anterior lens capsule. Anterior lens capsule. Then renal failure occurs. Colitis is typical. It resembles diphtheric colitis. It resembles diphtheric colitis. Acrodynia is also called pink disease. Pink disease. Okay. So the limbs, and it is like a chronic mercury poisoning in children. The limbs become pink, puffy, painful, paresthetic, pinkish, basically. Minamata disease occurs due to consumption of methyl mercuric, and it occurs basically in Minamata disease. The neurological symptoms predominate. It also occurs due to consumption of organic mercury. Basically, Minamata disease occurs due to consumption of organic mercury compound like methyl mercury, and the main thing is the neurological symptoms predominate. Okay, especially this methyl mercury is an industrial waste thrown in water, consumed by fish. The fish is consumed by human beings. Now, chronic lead poisoning, also called plumbism or saturnism. Features are A, B, C, D, E, F. A for anemia. Anemia is microcytic and hypochromic. And there is basophilic stippling of RBCs. Basophilic stippling of RBCs. Okay. B for Burtonian line. Bluish line on gums, as I told you. C for colic and constipation. Colic की pain आपका, please remember, most of the heavy metals they cause GI irritation, so they cause diarrhea. Lead is an exception which commonly causes constipation. D for drops. Foot drop, wrist drop. Okay. So lead palsy occurs. Lead palsy is a late feature seen in only 10% of the adults suffering from lead poisoning. Lead palsy is a late feature seen in only 10% of the adults suffering from lead poisoning. E for encephalopathy. Encephalopathy is an early feature seen in most cases of lead poisoning. F means facial pallor. It is the earliest feature. So please remember, facial pallor, earliest feature. Encephalopathy is also a quite early feature, but wrist drop and foot drop, these are the late features. Now copper, in copper, acute chronic, acute poisoning, the most characteristic feature is repeated vomiting, bluish in color. Okay, so repeated bluish vomiting, this is the most characteristic feature. Then there is hemolysis, hematuria, and renal failure. In chronic poisoning, if it is ingested, it basically, if the person is also predisposed, then it can lead to Wilson's disease. Obviously, there is genetic predisposition also, and basically in this, two organs are primarily affected: brain and liver. And in cornea, KF ring is formed. KF ring is formed on the Kayser-Fleischner ring is formed on the cornea. If inhaled, it causes Vineyard, Sprayer's lung disease due to long-term exposure to inhaled vapors of copper. Barium carbonate is used as a rodenticide, and typically remember, if you see low potassium levels and muscle paralysis, these are the characteristic feature of barium carbonate: hypokalemia and muscle paralysis. Cadmium causes basically bony features, pains, osteomalacia, osteoporosis, pain in the bones. Because of the pain in the bones, it is also called ouch disease. It was commonly seen in Japan, so also have this name Itai disease. Osteomalacia, osteoporosis, bone pain, fracture are the typical, and also causes PCT necrosis. Cadmium. Please remember, these are the 8 important plant irritants. The first 3 RCA, Ricinus, Croton, Abrus. Ricinus, Croton, RCA. Ricinus, Ricinus, Croton, Abrus. RCA. These first 3 are toxalbumin. Question many times asked. So toxalbumin is a plant protein which resembles, though it is a plant protein, but it resembles bacterial toxins. So features similar to bacterial toxicity occurs. These are plant proteins, toxalbumin, but they resemble in their physiological features, pathology, they resemble bacterial toxins. So ricin, RCA, ricin, croton, and Abrus precatorius. The second three, Semicarpus, Calotropis, Plumbago. The second three, these three are commonly used for causing artificial bruise. Artificial bruise. Okay. Then another thing that you should know is this Semicarpus anacardium. Semicarpus anacardium. This is a marking nut used by Dhobi people to do marking on the clothes. This Abrus precatorius, for the Abrus precatorius, you remember two important features. It is used to prepare sueys or needles and used to inject, which can either lead to injury to the person, poisoning to the person, or injury to the cattle. And the Abrus precatorius, it causes bleeding from the various body sides. So it resembles viper snake bite because it causes bleeding from the various body sides. So Abrus precatorius causes resembles viper snake bite. No. Ergot. Ergot is it's the infection of it's a fungus claviceps which grows on the. So this is the rye plant. This is the rye plant on which the claviceps grows. Claviceps fungus grows, and consumption of this claviceps, this lead to a poisoning called ergotism. And ergotism poisoning basically is of two types. One is convulsive, second is gangrenous. Gangrenous has typical features. In gangrenous and convulsive, these are the two kind of typical features which occurs in ergotism. In gangrenous poisoning, basically the extremities, hands, especially hands, there vasoconstriction occurs. In the hands, vasoconstriction occurs, which leads to burning sensation, okay, pain, redness, etc. And ultimately, it can be because the vasoconstriction has occurred, blood supply has been disrupted. So ultimately, gangrene can also occur, and it resembles Raynaud's phenomena. Because of the vasoconstriction, it resembles Raynaud's phenomena. So because there is so much of burning sensation in the hands and all, so it is also called St. Anthony's fire. Okay. And second thing is when predominantly convulsions occur, the convulsive features. So these are the irritant plants. Ophitoxemia, snake poisoning. Basically, remember three main kind of poisons, snake poisons: neurotoxic, vestrotoxic, and myotoxic. In neurotoxic, we have cobra and krait. In vasculotoxic, we have V for vasculotoxic, V for vipers. So, Russell's viper, saw-scaled viper, pit viper. So, all vipers are V for viper, V for vasculotoxic. Myotoxic is sea snake. In India, which are the common? The common four in India are cobra, krait, Russell's viper, and saw-scaled viper. These are the big four, which are found in most commonly in India. Neurotoxic will basically cause paralysis of various body muscles like drooping of eyelids, paralysis of other body muscles. Vasculotoxic will basically cause V for vasculotoxic, bleeding, coagulopathy. Myotoxic will basically cause myoglobinuria. Okay, and another feature that you have to remember, especially a very characteristic feature of krait, two features of krait. First of all, it is painless and it is nocturnal. Krait is painless and nocturnal. So very commonly it happens, a person is sleeping on the floor, a snake will come, it will bite it, Now, because it is painless, the person may not even come to know, and it comes in the night, and in the morning, the person is dead, already dead. So this can also happen in crate poisoning. Now, treatment, if I talk about the treatment of snake bites, one is the first aid treatment. Then we get anti in the hospital. In the hospital, we give ABC, fluid, blood circulation, then anti-snake venom, and neostigmine also. First aid treatment is not much use, not of much use. It is very much useful in rabies, but not in snake bite. Please remember, in first aid treatment, you can divide into three categories: always to be used, may or may not be used, not to be used. Okay, always to be used. Remember the mnemonic RIB. Always to be used, RIB. Reassure, R for reassure, I for immobilize the limb, B for keep the limb below the heart level. RIB. RIB is always to be done. Reassure, immobilize the limb, and keep the limb below the heart level. Okay. May or may not be done. It is pressure immobilization. Pressure immobilization. And cleaning with soap and water. These are plus minus, may or may not be done. Pressure immobilization is actually done for neurotoxic, but not done for vasculotoxic. Because in vasculotoxic, the local effects are very high. So we do pressure immobilization that can lead to amputation. And cleaning with soap and water, not of much use, may or may not be done. So please remember, RIB, always to be done, plus minus, pressure immobilization and cleaning with soap and water. Then never to be done is the tight tourniquet, use of chemicals, use of any incisions, sucking the venom with mouth. These are not to be done in any case. Okay. Now, in hospital, when the person goes, first of all, ABC, airway, breathing, circulation, obviously that you will do. Anti-snake venom is the main treatment which can save the life of the patient. Please remember, anti-snake venom is the main treatment which can save the life of the person. We will talk about it more later on. Neostigmine can be given in cases of neurotoxic snakes. When they are having paralysis, they can be given in the cases of neurotoxic snakes. Now the question comes, this anti-snake venom, it basically contains, it's polyvalent. It contains anti-venom against all the big four snakes. When to give? It has to be given only in case we are suspecting poisonous snakes. So if we have to look if the features are any systemic features is present, like bleeding, paralysis, you give the anti-snake venom. If only local symptoms are present, if they are serious, severe, then also give the anti-snake venom. But if it is only mild and no local symptom, then don't give the anti-snake venom, but observe the patient for 24 hours. Question is asked on the differentiation between poisonous and non-poisonous snakes. The problem is how to remember. So, the poisonous, very simple thing, if you can remember, poisonous snake, non-poisonous snake. Remember one term, just one thing you remember, and you will not forget. for your life. BLP. Just remember this word. B for belly, L for large, P for poisonous. So belly scales are large in poisonous snakes. So belly scales are large in poisonous scales. So B, L, P. In non-poisonous, they are small. So this is for the belly scales. In head scale, it is opposite. In the head scale, they are small in poisonous and large in non-poisonous. But there are certain exceptions. That means when they are in certain exceptional conditions, large head scales can be found in poisonous snakes. In certain conditions, large head scales can be found in poisonous snakes. Which are those conditions? These are cobra, crate, and pit viper. In these three are poisonous snakes, but the head scales are large. Now, which is the spinal poison? The spinal poison is Strychnos nux vomica. It's a CNS stimulant. It stimulates all the parts of CNS, especially the spinal cord. All CNS, but especially the spinal cord. It causes seizures. Okay, and it affects all the muscles simultaneously, as opposed to tetanus. In tetanus, the muscles are affected gradually. So all S, you can see S for spinal poison, S for strychnosis nux vomica, S for stimulant, S for spinal cord, S for seizures, S for all muscles affected simultaneously, as compared to tetanus where the muscles are affected gradually. So this is the spinal poison. Peripheral poison, two important peripheral poisons, curare and hemlock. Please remember, curare and hemlock are the peripheral poisons. So here in these poisons, peripheral poisons as well as the spinal poison, the consciousness remain intact. It's a painful death. In both peripheral poisons as well as spinal poisons, the consciousness remain intact. So it's a painful poison. And two important peripheral poisons are curare and hemlock, which causes paralysis of various body muscles, and especially the person dies because of the paralysis of the respiratory muscles, respiratory failure. Cardiotoxic poison, simple mnemonic Dhonak. D for digitalis, E for hydrogen cyanide, O for oleander, N for nicotine, A for aconite, K for quinine. Okay, so these are cardiotoxic poisons. Please remember, aconite resembles horseradish. Okay, that's the reason it can be mistakenly eaten. It resembles horseradish. The main features are it first stimulates and then depresses. The characteristic features is tingling followed by numbness and hippus. These two, if you can remember, these two are the most important. Tingling, numbness. Hippus, alternate contraction and dilatation of pupils. Alternate contraction, dilatation. These two features you remember. Tingling followed by numbness and hippus. Hippus is alternate contraction and dilatation. Hydrogen cyanide, the order is very important. Any idea which order? We have read about this. Almond-like order, okay? Rotten almonds kind of order is seen. Rotten almond. It basically inhibits respiratory chain enzymes like cytochrome oxidase and carbonic anhydrase. The antidotes are very important. basically, if we talk about the antidotes, various antidotes can be used. In the cyanide antidote kit, we use the nitrites and thiosulfate. Most commonly, the purpose of nitrites is nitrites converts attached with hemoglobin to form methemoglobin. The methemoglobin then has more affinity for cyanides. So cyanides attach to methemoglobin and the hemoglobin becomes, and the cytochrome oxidase become free. Okay. Sodium thiosulfate, the sodium thiosulfate also acts with cyanides to form thiocyanate, which is harmless, but because thiosulfate is slow to act, so thiosulfate is not given alone, it is given along with nitrites. Okay. Similarly, there are other compounds which can displace cyanides from the cytochrome oxidase. There are other compounds which can replace cyanides from the cytochrome oxidase. These are hydroxycobalamin, dicobalt EDTA, and dimethyl aminophenol. So, if I have to talk about the antidotes, nitrites, amyl nitrate given immediately by inhalation, then sodium nitrate given intravenously. These two, the nitrites, the main thing of nitrites is they will convert hemoglobin to methemoglobin. Methemoglobin combines more easily with cyanides, so cyanides get displaced from the cytochrome oxidase. Sodium thiocyanate directly acts with cyanide, but slow to act. Then we have hydroxycobalamin, dicobalt EDTA, and dimethyl aminophenol. Chloral hydrate is also called dry wine. It's mixed with alcohol, food or drinks, and given for crime, the criminal crime purposes. Okay, the person becomes delirious, stuporous. Okay, and it is mixed with, especially with drinks, it is mixed with alcohol and all. The person becomes subconscious. And this mixture of chloral hydrate with drinks is also called Micafin or knockout drops. Lathyrus sativus, how much consumption will lead to paralysis? When lathyrus sativus is a part of more than 30% of the diet and consumed for more than 6 months. It is a part of more than 30% of the diets and consumed for more than 6 months. The active principle is beta oxalyl amino alanine. So main thing is it just causes spastic paralysis, pure motor spastic paralysis. There is no effect on, and even there is no effect on sensation, no effect on sphincter, and there is no atrophy because it is spastic paralysis. Okay, so it just causes spastic paralysis. All other things are intact. Muscles don't atrophy, no effect on sensations, no effect on sphincters. Metal fume fever is caused due to it's an occupational health hazard caused due to exposure to the vapors of zinc, ZAM, remember ZAM. Z for zinc, most common, zinc is most common. A for aluminium, M for magnesium, ZAM. Basically, it causes malaria-like or flu-like symptoms. Okay, chillness, chest pain, fever, all these things. Phosphorus, white and red. So, which one is toxic? White phosphorus is toxic. White phosphorus is, so white, toxic, garlicky, luminous. Remember this word. White phosphorus is toxic. So white is toxic, white is garlic, white is luminous. Okay, garlicky taste. So white, toxic, garlic. White, toxic. Remember this one line. White, toxic, garlic. White toxic garlic. Because white is toxic, so on the so in fertilizers, white phosphorus is used, but on the matchsticks, which we use on daily basis, there we use a non-toxic one, that is the red phosphorus. Okay, and the main feature of acute phosphorus poisoning, you remember fatty liver. For chronic phosphorus poisoning, you remember Fossey jaw. Acute phosphorus poisoning, the classical feature is fatty liver, and chronic phosphorus poisoning, the classical feature is Fossey jaw. These are the common hallucinogens which basically cause disruption in the perception. Phencyclidine, LSD, mescaline, psilocybin, and DMT. Priapism is caused by triple S. Please remember: spider, scorpion bite, and Spanish fly. Triple S causes So coming to sewer gas basically, remember the mnemonic CHAMES. Sewer gas consists of carbon monoxide, hydrogen sulfide, ammonia, methane, esters, sulfur dioxide. Okay, this is what is composed of sewer gas. Chinese restaurant syndrome occurs due to which component? Monosodium glutamate. Okay, so this was about the rapid revision of toxicology. Now let's start with the rapid revision of thermal injuries. Thermal injuries, if we talk, how do we classify? Injuries due to cold, injuries due to heat, general effects, local effects. Same thing, general effects, local effects. In the local effect, in coming to the injuries due to cold, general effects, few important body temperatures. What is the normal body temperature? Around, we can say 37, 38 degrees Celsius. What is hypothermia? Below 35 degrees Celsius, or you can say below 95 degree Fahrenheit body temperature. Number third, death can occur below 28 degree Celsius body temperature. Feature which is seen as in hypothermia deaths is commonly fatty necrosis of pancreas. Number fifth, paradoxical undressing. These are the features of hypothermia deaths. Hypothermia deaths. Now, coming to the local injuries due to cold. Local injuries due to cold, basically you have to remember three injuries. Chilblains. Number two, trench foot, also called immersion foot. And third is frostbite. So if I talk about this is less severe to more severe. Less severe to more severe. Now, trench foot is occurs at what temperature? 5 to 8 degrees Celsius. Frostbite occurs below minus 2.5 degrees Celsius. Usually, trench foot or immersion foot also occurs when there is dampness. For example, typically, as you see the word foot in the water, okay. So, soldiers with shipwrecked, ship damaged, I mean. So, foot, remember the word by foot. So, soldiers' foot in water. Suppose a ship is damaged, soldiers' foot remain in cold water. So, water plus coldness, that leads to trench foot or immersion foot, 5 to 8 degrees Celsius. Frostbite is the freezing injury below minus 2.5 degrees Celsius. So, bite. From the word bite, you remember that it is so severe that even the amputation may require. So what happens is, in chilblain, there will be simple redness, Okay, itching, these things will be there. So less severe injury. In trench foot, there can the limbs can become pale, loss of numbness. These things can occur in case of trench foot or immersion foot. Frostbite is more severe. Here it can, what can occur is it can even become gangrenous. Gangrene can occur and complete amputation may be required. Bite, amputation. Remember like this, bite, amputation. All of them basically occurs in extremities, because in extremities the blood supply is less. Okay, so all of them commonly occurs in extremities. Especially, please remember, frostbite especially occurs in which extremities? Left. Nose, ear, finger and toes. Okay. Now, coming to injuries due to heat, general effects due to heat. General effects due to heat. So remember like this, the 4 kind of basic injuries. Number 1 is heat cramps. Number 2 is heat syncope, also called heat. Number 1 is heat cramp. Number 2 is heat syncope. Number 3 is heat exhaustion. And number 4th is heat stroke. Again, same thing, less severe to more severe. Okay, so which one is life threatening? The most severe, that is, this can be even life threatening. In heat stroke, even death can occur. What are the features? In heat cramps, there is, please remember, now it comes to sweating. Sweating is present in all except heat stroke. In heat stroke, it is dry. Pupil dilatation. Pupil dilatation is also present in all pupil dilatation is present in all except heat stroke, and there is pupil contraction. Okay, so please, so these are the 2 features, pure sweating and pupil dilatation. They are present in the first 3, but in the heat stroke it is opposite. That is no sweating and pupil contraction. Okay, then what are the other differences? Now in heat cramps, obviously there are cramps. These cramps will be present here also, in heat syncope also, and in heat exhaustion also the cramps will be. So features of heat, so please remember the features of heat cramps, heat exhaustion and heat syncope. These 3 are first 3 are quite similar. Heat stroke is totally different. Okay, so in all first 3, on all of them there is sweating, all of them pupillary dilatation, all of them cramps. But what's the difference between these? So heat stroke we can discuss separately, in the first 3 separately. So sweating, pupil dilatation, cramps is present in all. Now additionally, the heat syncope, there will be decreased blood pressure also, which will lead to fainting. Okay, now this decreased blood pressure and fainting is present in heat exhaustion also, but in heat exhaustion one more additional feature is present, that is increased body temperature. Increased body temperature. Okay. And then in heat stroke, it's a bit different. So in heat stroke, one easy way to remember is that body temperature is very high, more than 41 degrees Celsius. Other things are decreased. Other things are decreased, like sweating decreased. Okay. Then pupil size decrease. This is how you can remember. Sweating decrease, pupil size decrease, then Purkinje cells in cerebellum decrease. Purkinje cells in cerebellum decrease. And also there is neurological disturbances. Because of such a high temperature, neurological disturbances occur. Okay, so very easy to remember. In heat cramps, there is sweating, pupillary dilatation, cramps, and also dilutional hyponatremia. Hyponatremia. In heat syncope, all the features of heat cramps are present. In addition, decrease in blood pressure. In heat exhaustion, all features of heat syncope are present. In addition, increase in body temperature. Okay. In heat stroke, features are totally different. Instead of sweating, no sweating. So easy way to remember is heat stroke is body temperature is very high, all other things are decreased. So body temperature is more than 41, other things are decreased. Sweating decrease, pupil size decrease, Purkinje cells in cerebellum decrease, and neurological disturbance because of high body temperature. Now, local effects of heat. So basically it's dry heat, moist heat, and heat due to chemicals, especially corrosives. Okay, dry heat means flame burns, heated metal, etc. Moist heat is due to is also called scalds. Okay, it's due to the hot liquids above 60 degree Celsius. Hot liquids above 60 degree Celsius. So if I talk most importantly about the depth, so this flame burns can be either superficial or deep. You remember like this, the fire can cause deep burns also and superficial burns also. It can be superficial to deep, both can occur. Scalds, water, that will basically mostly cause superficial burns. So moist heat will basically cause superficial burns. Chemical burns, corrosives penetrate deep, so they will basically cause deep burns. Deep burns. Number 2 is pain. This can be painful. This can be also painful, but this is usually painless. The corrosive burns are usually painless because they penetrate deep and the nerves are damaged. Number 3, blisters. Now, blisters usually occur in the layer of the skin. epidermis, dermis, there the blisters occur. So because flame burns can be superficial. Whenever if the skin is damaged, then there cannot be any blister. So in chemical burns, always called deep burn. So blisters are absent in chemical burns. In moist burns, superficial burns, blisters are commonly present because the skin is intact. In dry heat, skin may be damaged or it may not be damaged. So blisters are usually present at the margin. So blisters are present, but they are not so much as they are found into the moist heat. Then singeing, burning of hair. Burning of hair will obviously be seen only in flame burns. It will not be seen into the moist heat, or it will not be seen into the chemical burns. Okay. Now, coming to extradural hematoma due to heat and extradural hematoma due to trauma. Extradural hematoma due to heat is also called heat hematoma. And this is simply called traumatic EDH. So what you have to remember here is which one will be unilateral and which one will be bilateral. In heat hematoma, all the blood vessels will be ruptured, so it will be bilateral. Traumatic will occur only on the side of trauma, so it will be unilateral. That is the most important difference. So this is diffuse, this is localized. Then number 2, because of the effect of the heat, the blood will remain fluid. So this is the blood remain fluid, and in traumatic EDH it becomes jelly-like. Then number 3, in which case the fracture will occur? Obviously it will occur. So fracture can occur in both. Okay. So here in heat, the fracture will occur because of the effect of the heat. Okay. The skull can crumble. So it will be diffuse skull, multiple places. Fracture can occur at multiple places. And here the fracture will occur at the side of trauma only. Then in case of heat hematoma, brain injury will be present in which case? Brain injury will be present in trauma, because trauma is occurring, so the brain will get injured. So brain is usually intact in heat hematoma, but injured in case of traumatic EDH. Now coming to heat rupture. Heat rupture occurs because of the skin contraction by heat. It can resemble both laceration. It usually resembles lacerations, but sometimes it can resemble incised wound also, sometime, rarely, but usually laceration. Why? Because it also has heat rupture also has, both heat rupture and laceration has irregular margins. So they more commonly resemble laceration, but rarely they can resemble incised wound. So heat rupture has irregular margins. The feature which distinguishes heat rupture from lacerated wound or incised wound is, in laceration and incised wound, because there is trauma, so the blood vessels and nerves are injured. Whereas in heat rupture, the blood vessels and nerves are intact. Blood vessels and nerves are intact. So difference between ante-mortem burns and post-mortem burns is very simple. I think the soot in trachea present in ante-mortem burn, increased carboxyhemoglobin, ante-mortem burn, line of redness also ante-mortem burn, vital reaction also ante-mortem burn, enzymatic reaction increase also in. So all these things are vital reactions. So they will be increased in ante-mortem burns only. They will not be present in post-mortem burns. Now coming to blister, blister is also typically a feature of ante-mortem burn only. But some blister can also be present in post-mortem burn. But the difference is in ante-mortem burns, the blister, there will proper inflammatory reaction is there. So there is proteins, chlorides, serous fluid. Whereas in post-mortem burn, there is just thin clear fluid or just air, not much. In ante-mortem burn, because inflammation is there, so the base of the blister will be inflamed. It will be reddish, moist, swollen. When post-mortem burn, it will be yellowish, dry, and hard because no inflammation is there. So easy to remember. Now, coming to the cause of death. Cause of death in burns. Okay, so it can be considered as immediate cause. When I say immediate cause, it basically means less than 24 hours. The second can be delayed cause. Delayed cause means after 24 hours. Delayed cause can further be divided into between 24 to 48 hours, then 48 to 72 hours, then after 72 hours. Okay, after 72 hours. Immediately how the person can die? Immediate cause can be either neurogenic shock or asphyxia due to gases. These are can be the immediate causes. 24 to 48 hours, the cause is usually hypovolemic shock. In 48 to 72 hours, the more important cause is toxemia due to release of toxins from the tissues. Toxemia from the release of toxins from the tissues. After 72 hours, the most common cause is septicemia, infection. Okay, so in general, if I ask you amongst all these, which is the most common cause? The most common cause in general amongst all these is hypovolemic shock. Okay, so these are so just a quick revision. Normal body temperature 37 degrees Celsius, hypothermia below 35 degree Celsius, or you can say below 95 degree Fahrenheit, trench foot or immersion foot 5 to 8 degrees Celsius, frostbite minus 2.5 degrees Celsius, minimum temperature to produce burns 44 degrees Celsius, heat stiffening occurs at body temperature above 65 degrees Celsius, scalds occur due to hot liquids above 60 degree Celsius. Now, burn surface area, please remember there are two rules used. The Wallace rule of 9 is used for adults, and Lund and Browder rule. Lund and Browder rule is used for children. Okay, so rule of adults is very simple. All of you must be knowing. I will not going to repeat this. Simple. 9, front of limbs 9. So I can say it's a rule of 9. So if we have to make it like this, So this is in rule of 9, it is basically for adults. When I say adults, let us consider more than 9 years. I will explain how it is below 9 years, different formula, Lund and Browder is used. Above 9 years, you can simply use the rule of 9. So 4.5, 4.5. This 4. Okay. This is 9, this is 9. This is 9, this is 9. 4.5, 4.5. 9, 9, 4.5, 9, 9, 4.5. Genitalia 1%, palm 1%. 1%. Palm 1%, genitalia 1%. Now, coming to the now, how do you compare it with adults and children? Now, see, in adult versus children, adult means more than 9 years here, and children means less than 9 years. Please remember that basically only there is a difference between the head and the lower limbs. There is a difference only in head and lower limbs. The trunk and the upper limbs, their proportionate surface area is same in adult and children. Okay, so trunk and upper limbs is same. The difference between adults and children is only between the head and lower limbs. So you remember like this: in head in adults is small, in children it is large. So lower limb is opposite. Lower limb will be large in adults, small in children. So head is 9% in adults, and each lower limb, if I talk about each lower limb is 18% in adults, 9 in front, 9 in back. Now, what you do is, for children, what you do is, here you write one more box, newborn. You write less than 1 year. When the newborn or less than 1 year, 0 to 1 year, you write one more thing here, 0 to 1 year. So, in an adult more than 9 years, in an adult more than 9 years, the head is 9%. When the child is born, the head is double, 18%. And in a child, in adult, the lower limb is 18%. Each lower limb, complete lower limb is 18%. In child, this will be small. Each lower limb is 14%. So below 1 year, this is the thing. Now, between 1 to 9 years, how do you calculate? Between 1 to 9 years, how will you calculate? What you have to do is, see, as the age will progress, the head will become small and small. So head is 18 minus age percentage. The head will be 18 minus age percentage. And each lower limb, because each lower limb will keep on increasing, it will be 14 plus half of age. So if I ask you, in a 6-year-old child, what will be the head? 18 minus age, it will be 18 minus 6 equal to 12%. And each lower limb will be equal to 14 plus half of age, it will become equal to 17%. Clear? This is how you have to do. So this is an approximation. Don't get confused that at 9 years it will become 14 plus 4.5. So that is 18.5. That is okay. But these are just the approximations. Okay. So that you can remember. Now, electrical injuries. coming to electrical injuries. Electrical injuries can cause injury due to depolarization, then muscle contraction, that is trauma. Muscle contraction leads to physical trauma, and third is due to burns. Depolarization, the most common depolarization can lead to sudden ventricular fibrillation, which can cause sudden death, or respiratory failure can occur if the current goes through the brainstem. So if the current goes through the heart, ventricular fibrillation can occur and sudden death can occur. If the respiratory failure can occur, if the current goes through the brainstem. This ventricular fibrillation is the most common cause of death in electrical injuries. Muscle contraction leads to physical trauma. Now coming to burns, electrical burns can be of two types: endogenous burns and exogenous burns. In endogenous burn, there is a contact, firm contact, I will say, firm contact with the wire. In exogenous, no contact or loose contact. No contact or loose contact. So typical example of endogenous burn is Joule burn. Joule burn is a burn at the electric contact point. What are the features of Joule burn? There is crater, shallow crater with a raised skin, pale raised skin surrounded by a small zone of hyperemia. Surrounded by the zone of hyperemia. So number one is crater, number two is pale raised skin, and the last is zone of hyperemia. Exogenous burn can be of two types: spark burn, also called flash burn. It's a small brownish nodule like this. Brownish nodule is formed. Hard brownish nodule. So one is the Joule burn, second is the spark burn, also called flash burn, and the third is the crocodile burn. Crocodile burn, it occurs in high voltage currents near the high voltage sources. It occurs near the high voltage sources. So crocodile burn is nothing but multiple spark burns. Okay. Then we have lightning burns. What are the other name for lightning burns? The other name for lightning burns are Lichtenberg flowers, filigree burns, fern-like pattern, or arborescent burns. Arborescent burns. Okay, so this was about the thermal injuries. Now coming to the type of stains. Now in stains, what you have to remember is Just 3-4 questions are to be answered. You remember like this: human or other animal? This is the first question to be answered. The second question to be answered is it sperm? Is it semen? Third question to be answered is it blood? And the fourth question can be answered is, if it is blood, then what is the blood group? These are the 4 questions for which you require an answer. Whether it is human or animal, which is the most common test done? Precipitin test. But there are other tests also, but the most common is precipitin test. If you see here, these are the tests, serological tests are for detecting whether they belong to human or animal. This is the most important one which is asked in your exam, precipitin test. Now, coming to whether it is semen or blood, or it is, so in both of them, like, is it semen? If I talk about is it semen, we have preliminary test, presumptive, I will say presumptive, not preliminary, presumptive test, and confirmatory. Presumptive test will be fluorescence of semen in ultraviolet light. Fluorescence of semen in ultraviolet light. And second is microchemical tests. Which are the microchemical tests for seminal stain? The microchemical tests are Florence test and Barberio test. Florence test and Barberio test are the microchemical tests for, and the confirmatory tests for seminal stains are, number 1 is presence of complete sperm, detection of complete sperm, which can be seen either in the microscope, or by LDH, isoenzyme method. Microscope or LDH isoenzyme method. Second is acid phosphatase test. This is also a very good test. These two are almost confirmatory tests. Then we can also do creatine phosphokinase test. Creatine phosphate. These are confirmatory tests. So similarly, if I talk, is it blood? Again, presumptive tests or confirmatory tests. In presumptive tests, we have luminol spray test and macrochemical tests. In macrochemical tests, hydrogen peroxide is used. Hydrogen peroxide is used, and the different kinds of macrochemical tests are leukomalachite test, orthotoluidine tests, okay, then benzidine test. So there are many others, these kind of tests which are macrochemical tests, which are presumptive tests. In the confirmatory test, please remember the microchemical tests for seminal stains are presumptive, but the microchemical tests for blood stains are confirmatory. The microchemical tests for blood stains are, there are two microchemical tests. One is Takayama test. The other is Tickman test. Tickman test is also called Heeman test. Takayama test is also called hemochromogen test. Hemochromogen test. Okay. Another confirmatory test is spectroscopy. This is the best method, most confirmatory. This is the most reliable. This is the most reliable method. So three questions answered: human or other animal, is it semen, is it blood? The fourth question is, what is the blood group? Here we are talking about the blood grouping of a stain, not the blood grouping from the person. So here, there are different tests which can be done for blood grouping. So these are the different tests. Please remember, lattice crust method is especially important to detect blood group in an old blood stain. Old blood stain. Lattice crust method is especially useful. So now coming to the last rapid revision, that is forensic psychiatry. That topic itself was very small. So basically, these were the three important sections: 84, 85, 86. 84, 85, 86. 84 is basically for mental illness, criminal responsibility of mental illness, derived from McNaughton's rules. '85 is for involuntary intoxication. 86 is for voluntary intoxication. So please remember, in 84 and 85 the person is not responsible. In 86 the person is responsible for the crime that he commits. So initially there was Indian Lunacy Act, which was passed in 1912, which was replaced by Mental Health Act passed in 1987, and then it was further amended to Mental Health Care Act in 2017. Okay, so in this, the classical feature, the main feature of 2017 Mental Health Care Act was the advanced directives. That is, it defines how the patient has to be treated if he becomes mentally ill. Lucid interval, lucid interval is the period. So there is abnormal behavior, then there in between there can be a normal behavior, again abnormal behavior. So this period of normal behavior is called lucid interval. Here in this, the person can make will. In this lucid interval, the person can make will and he can be held responsible for the crime. If he commits a crime, he will be held responsible. What is the holograph will? Holograph will is a will written by a testator in his own handwriting. What is testamentary capacity? Testamentary capacity is ability to make a valid will. Please remember, these are the different tests that a psychiatrist can use to determine if a person is mentally ill or not. One is the McNaughton's rule, which is same as 84 IPC, also called legal test or right or wrong test. Then there is doctrine of partial responsibility, Durham's rule, Curran's rule, American law of institute test, Norwegian syndrome, and irresistible impulse act. You don't have to go into detail, just remember these are different tests used to determine whether the person is mentally ill or not. So please remember one thing, that in few conditions where the person is responsible or not, responsible. If only impulse, out of impulse person is doing something, he will be held responsible. If the person is doing, or because he is suffering from OCD, he will be responsible because he has the insight. If person is doing because hypnosis, he will be responsible because even in hypnotized state, he is not in completely, he may be to some extent controlled by the other person, but he is not completely out of reality. Not responsible or not responsible, delirium, any delirium, because the person is lost in time, place, person. Then somnambulism, not responsible, sleepwalking. Now any serious mental illness in general, we can say the person will not be responsible. For delusion, usually the person is not responsible. So for delusion, actually you can write plus minus, usually not responsible, but in some instances when the delusion is totally of some different nature and the crime is of different nature, in that condition the person can be punished. So delusion, it can be plus minus, but usually not responsible. So remember like this, delusion plus minus, but usually not responsible. So this was the rapid revision of for all forensic medicine, which will help you a quick recap. Thank you very much.